Hello everyone. This is Madish Parekh, and I welcome everyone to Gujarat Youth Conclave, which is Gujarat's first ever youth conclave to relief operations carried out during COVID lockdown by young people across the state. Where a strong need was felt to build a collaborative platform for young people. GYC takes up the role to recognize champions of change from grassroots and facilitate youth development. The first edition of two-day conclave, it will have four powerful panels. Number one is Youth for Health in COVID-19. Number two is Youth in Education. Number three is Youth in Innovation Research. And number four is Youth for Climate Change. The conclave will witness expert talks from leaders, change makers, doers, and thought leaders. GYC is organized by Gujarat Youth Forum, supported by Center of Excellence, Gujarat University, Elixir Foundation, Earth Day, British Deputy High Commission, Gujarat and Rajasthan, GUSEC, NetCivis, Creative Yatra, Isaac in Ahmedabad, Teachers, Swasarjan Regulations, in partnership with National Service Scheme, UVA, and UNICEF India. We are very much thankful to Center of Excellence and UNICEF India for supporting us in building of Gujarat Youth Forum and the building of Gujarat Youth Conclave. We are looking forward to your support and partnerships in future to enable and empower young voices. We encourage participants to post questions, suggestions to the panel, and share about the conclave on social media with hashtag GYC2020. Now, before starting, firstly, what we are eagerly waiting for is the inaugural talk. So, I would like to introduce the chief guest for the inaugural. We have Dr. Kamal Kumar Kar. He is from the Directorate of National Service Scheme, New Delhi. We have Safin Hassan. He is an IPS. He is an Assistant Superintendent of Police, Bhavnagar Subdivision, Bhavnagar, Gujarat. We have Lakshmi Madam, Chief UNICEF Gujarat. And I'll give a one-liner introduction of everyone. Dr. Kamal Kumar Kar heads India's largest youth volunteering organization, which is the National Service Scheme. And I also happen to be a volunteer of the organization. Safin Hassan, sir, is the youngest IPS officer, and he's a role model for thousands of youth across India, and a lot of young people aspire to be like him and serve the community and serve the nation. And Lakshmi ma'am is the chief of UNICEF Gujarat, who has been supporting many youth organizations across the state to work for children and young people. Thank you so much, everyone, for joining the panel. Firstly, I would like to invite Dr. Kamal Kumar Kar to give his special talk on this subject at Gujarat Youth Congress. Thank you.
Thank you, Madesh. I'm audible?
Very much, sir.
Yeah, thank you. So welcome and namaste to all whoever are watching this launching of Gujarat Youth Conclave. My co-panelist, Mr. Hassan, as well as Madam Lakshmi. I'm privileged to be here in this launching ceremony of Gujarat Youth Conclave. Not only the part heading the organization of NSS in New Delhi, but I had a long time in Gujarat where I have worked with the Gujarat youth as well as student volunteers since 2011 up to 2019. So 7.5 years I had worked there, and the youth, they have lot of tremendous potential they are having. So to channelize these youth, to get their youth power into a proper track, it was felt that some sort of platforms should be available for them where they can also devote their time, they can deliver, their output will be there also, and some positive development will be there in the community. So far as NSS volunteership is concerned, it is only restricted for 2 years, because while they are in NSS educational institutions, these volunteers, these young students, they work in the community, they come directly in contact with the community to see the problems, and they become part and parcel of the solution. I can share my experience here. In number of villages, our volunteers, they have tried to uplift the economic standard of the people by doing some innovative works, by arranging small business for these people, by arranging education for the children who are deprived like that. So after the formal education is completed, these volunteers, they are unable to be in part of any formal system. So they cannot join in NSS, or some of them work as the Nehru Yuva Kendra Sangathan volunteer, which is a Government of India program for the non-student youth. But as a whole, if we see, when they want to devote for a better cause or devote some innovative work they want to do, they want a particular platform. And I think this is an innovative idea which has been floated by all of our young volunteers and young friends. So these volunteers will definitely be beneficial. They will be definitely be getting more benefits by joining these conclave. Now, what will be the major thing? The major output of these volunteers should be, uh, apart from a particular few groups who are working, who are working in a particular specialized field, I can say. Leaving them, the general youth, they want a centralized platform where a large number of youth can gather together and they can do a particular project in the society. That may not be financially that much high one, but very, very small things. Suppose there are 5 to 7 shops in the villages, and if our volunteers they provide the dustbins for them, and that shop becomes clean, and the Swachh Bharat Abhijan they also contribute to the part of Swachh Bharat Abhijan. They can pass the information, they can start to inculcate the habit of doing the cleanliness in the villages. In the urban area also our volunteers are working. In rural area they can do this type of thing. Suppose our computer students are there, our engineering students are there, they can do in a better manner to how to harness the natural source of energies are there, how to harness the solar power, how to work on a computer, because primary school computer systems are there which are not properly working. If our young volunteers who are having the computer science courses, they can help to build up the computers, the maintain the computers like that. These are the small things. So innovative things. Apart from that one, the regular things which our volunteers, our youth, they can contribute in the society. That will be a major thing which generally these students can do in a long period of time, which we see that the youth are generally they are not been given any higher up responsibility, though
Okay, so we see a network issue with Dr. Kamal Kumar sir's internet, I think so. So meanwhile, I would like to take the opportunity to invite Safin sir and give his special talk on Gujarat at Gujarat Youth Conclave. We heartily invite you, Safin sir. Yeah.
Yeah, Madesh, thank you so much for the invitation. I hope I'm audible and visible both.
Yes, very much, sir.
All right. So, first of all, a heartful congratulations to you and your team for coming up with such a wonderful conclave, which when I was in my college days, I was planning to, initiate such kind of things. And I'm very much happy to see that things are actually getting place, in Gujarat. Now, coming to the concept of Gujarat Youth Conclave, and when I'm supposed to talk and interact with the youth of the nation, the very first thing I would like to tell you is that this is the best platform to come up with to channelize the energy, the ideas, and the potential of the country, which is considered to be the youngest country in the world. But unfortunately or fortunately, so much of the potential is not being used, or we are not in a position to utilize that demographic dividend which India is actually witnessing these days. So these are very crucial years. The coming 25 or 30 years, which we are supposed to witness, are the years of demographic dividend. And if we will not be able to harness these things, this demographic dividend can be a demographic disaster as well, if the enough opportunities are not generated in the country. So coming up with such a kind of platform which will help us to bring the all the ideas on one platform and try to pick up the best out of them and try to implement those in building of a nation, which our honorable prime minister has envisaged in his new India initiative Naya Bharat 2022. I hope this will be a milestone in that particular dream. Now, when I'm interacting with youth, I would like to send 2 3 messages to all of them, that if you really want to make a change, I would say that whatever you are doing, do in your best capacity, give your 100% to it. It will automatically contribute to the development of the nation. If you are a lawyer, give your 100% to your education, to your profession. If you are a doctor, give your 100%. If you are police, give your 100%. By giving your 100%, you are actually contributing to the development of the nation, and we are making the system stronger. See, what happens is that when anybody starts an initiative, it's always individual centric. Even this youth conclave also, I would suggest you that it might be an initiative of somebody right now, but you must make efforts that it should be institutionalized, and the efforts should be in the direction to strengthen the system, to strengthen the institution, and to strengthen the tradition. And this will go in a long way to sustain the tradition, to sustain this kind of good initiatives. Apart from that, I would suggest you that you should always remember Mahatma when we try to think in such areas, that be the change you want to see in the world. So I don't need to go on borders and fight wars, to contribute for the nation. Only thing I need to do is that whatever I can do in my personal capacity, I should give my 100% to it. If I put all the liters in dustbin, if I don't speed on roads, if I pay my income tax on time, if I don't violate traffic rules, if I switch off the lights and electricity when I go out of the room, these are the small things which you need to do if you really want to do something good for the nation. So here I would like to differentiate the concept of patriotism and nationalism. I don't need that we should go, everybody should go on borders and fight, but at least these kind of small gestures for the betterment of the nation will go a long way to save our prestigious resources and to make everything available to everyone. Apart from that, whatever the change making you are doing, all the youth I'm talking to, interacting to, might be associated with many social activities. Whatever you are doing, try to make it on a ground level reality possible. Sometimes many NGOs which I have come across during my short span of social activities, I would say that they're very much limited to clicking photographs, making social media posts, and then forgetting about what they have done or what actual ground level changes they have made. So again, their institutionalization comes into picture. Whatever you're doing, try to make sure, try to have an overall impact analysis on the ground level, that whatever you're doing, how much change is it making? No matter change, whether it's a change in the life of one person or the life of hundreds, but that change should be substantive, that change should be very much visible, and that one change will percolate, into the lives of many people. Somebody somewhere asked me, said, one person, what I can do as an individual. See, even the leaders, top leaders also started as an individual, and then they were leading the mass. So you can do whatever you want in your best capacity. I'm sure that people will start following you, and that change will percolate to the down state of the society. And the last thing which I would like to mention, and then we'll end my talk, that with time everything is changing, and we also need to change. As a youth, we need to challenge those traditions which have been part of the Indian society, but which are not actually contributing in the development of the country. We must challenge those old traditions. We must challenge the casteism. We must challenge the communalism. We must challenge corruption. We must challenge all other evils of the society which we have accepted as a part of the society. If we will start challenging this, we will be inviting the change in the society, and that will contribute in the development of a great nation which India has been, and that civilization of 3,000 years which we are proud of will be able to sustain that. So with this, I'll conclude my speech, and I wish you all the very best to all the youth people who has joined here, and to the organizers as well. And warm regards to my co-panelists. Jai Hind to my senior Vipul sir, who has also joined here, and wish you all the best. Thank you so much. Madish, you need to unmute.
Yeah, that's the digital life now. Mute and unmute, right? So thank you very much for giving a very inspirational talk, and you have beautifully expressed and explained the transition of young people from being an individual So you have beautifully expressed and explained the transition of young people being an individual to a leader, and at the same time being socially responsible to the nation and help in building the new India what we all dream of. And the other important point, what I liked of yours, what you said is give 100% to whatever you do, maybe it any profession, because every profession leads to nation building. I think that's a very important takeaway for young people who have joined the conclave. Thank you so much, sir. And I'll go back to Mr. Kamal Kumarkar, Dr. Kamal Kumarkar. Yes, sir. Over to you again, sir. Thank you.
Uh, Thanks, Madesh, and sorry for the technical glitch because, as you told, this is a part of digital life. So same thing, I don't have to repeat anything. Mr. Sapintel told the same thing which I was just going to say, that our volunteers at the grassroots level, they are doing the work. They are not doing for the name or fame anything. They are doing for the self satisfaction, and I'm very happy that after doing this work, they are getting self satisfaction, and at the grassroots level, they are bringing out certain changes, and certain changes are visible. Number of villages are being declared ODF. They are been now free of garbage and all the things. And constantly, our volunteers are working in different fields in all over India. Because as I am looking after the entire NSS organization in the country, lot of places our volunteers are working to teach the deprived students, to teach the dropouts, to enroll the adolescent girls in the school education. For this, during COVID, they have done tremendous work for managing the crowd, to help the district admissions, like that. So volunteerism has become a part and parcel of them. And as one responsible individual, if they in the future life, if they continue the same thing, then that is the main learning which they will carry. And definitely this Gujarat Youth Conclave will be a platform for them, and the youth will carry this sense with them. And with this, I wish all the best for the conclave, and I hope will be definitely grow in a large number, and in coming years will be coming out as a powerful and important platform. Thank you, and all the best to all. Jai Hind.
Thank you very much, sir. As you represent India's largest youth volunteering organization, and I understand what NSS means to country, because more than 50 years NSS has been giving services in nation building. And the volunteers, and I personally was an NSS volunteer, so I have experienced the change what the organization has given. Thank you very much, sir, for your special talk. Now I would request Lakshmi Bhavani ma'am, UNICEF Chief Gujarat, to give a special talk and formally launch the Gujarat Youth Conclave. Thank you, ma'am. Over to you.
Thank you, Madish. Am I audible?
Yes, ma'am.
Okay, thank you. Good evening, Dr. Kamalkar, Mr. Safin, Dr. Vipul, Mr. Madish, and all other partners, and all online viewers, especially the young people of Gujarat, my colleagues Vijay, Moira, Kumar, and welcome you all to this Youth Conclave. And first of all, I would like to express my gratitude to the Center of Excellence in CSBC, Department of Journalism in Gujarat University, Center for Communication of Child Rights in PDPU, GeoSec, and importantly, Elixir Foundation and NSS, and all other partners for organizing this Youth Conclave. I would also like to express my deep appreciation to all the panelists who have joined this session today. And this conclave, I think, has come at a very opportune time, as we are saying goodbye to the year 2020 and welcoming the new year 2021 with vigor, hope, and exuberance of youth power. And we are acutely aware of the fact that 2020 has been a very challenging year for all of us. The coronavirus pandemic has caused deep inequities in societies that left many people, especially the children, far more at risk than others. To reiterate UN General Secretary's comment, children might not be the face of the pandemic, but they are going to face the loss of the pandemic. The COVID-19 crisis is in fact child rights crisis. The costs of pandemic are immediate, and if we do not address them, they may persist for long. Children and young people will be living with the impacts of this pandemic, and how the world chooses to respond now will have an impact for the years to come. At this critical moment in history, the pandemic has exacerbated the gaps, and millions of children are missing out on the basic services like healthcare, cut off from the education, and left without protection. This is a time for generations to come together to reimagine the type of the world we want to co-create. The global community must listen to children and young people, working alongside them to design a better future for them. They must be included in decisions that affect their future. In this occasion, I would like to say that UNICEF is calling for some urgent actions to mitigate the worst effects of the pandemic on children and practically a recovery plan that reimagine a better future. To name few which are relevant particularly to our state, we should ensure all children to learn, including that we need to close the digital divide. Second, I think every child shall be guaranteed the access to nutrition and health services, and even the vaccines should be affordable and available to every child. We should also support and protect the mental health of the children and young people and bring an end to abuse, gender-based violence, and neglect. There shall be an increased access to safe drinking water, sanitation, hygiene, and we should address environmental degradation and climate change. We have heard Mr. Safin saying so many things that youth need to do, and there are many very, very relevant if we want to address the climate change issues and environmental degradation. And children and young people have the ideas and the talents to come up with solutions to some of the biggest challenges that humanity is facing today. Young people need a platform to express, collaborate, and share the ideas and views. The idea of having discussion and bringing multiple perspectives on health, education, innovation, and technology and climate in context of COVID-19 would certainly ignite more ideas and initiatives that will be required to build a resilient and healthy society and the healthy country. Youth engagement is also key focus of Yuva initiative, which most of you must have heard, to equip India's young people aged 10 to 24 years as problem solvers. We should engage them as catalysts of social change. Gujarat Youth Forum would be one collaborative platform, you will agree with me, to bring together youth in the state. This two-day conclave would certainly, I think, be an opportunity to be part of discussing, designing, and delivering the change that they envision, along with key stakeholders, decision makers, and experts. This would be a great way to move forward towards the new year. In today's context, young people have a significant role to play in continued practice and promotion of COVID-appropriate behaviors. I request all of you, please take the COVID-appropriate behaviors messages on masks, using the masks appropriately, hand washing with either soap or sanitizer, and distancing to everyone in the state, in your families to begin with, friends, networks, and neighborhoods. And use your digital and social media skills and influence to play this important role. This is the need of the hour. On behalf of UNICEF, I reaffirm our commitment to work closely with youth, especially in the areas that concern your lives today and towards securing your future. We join Gujarat Youth Forum in amplifying your voices. Best wishes for the 2 days of insightful reflections and look forward to your active participation. And I take this opportunity before concluding, wish you all in advance a very happy and promising new year. Thank you. Over to you, Madish.
Thank
You
you
are
very much,
muted again.
ma'am. Yeah, thank you very much, ma'am, for your inspiring words. And we definitely will make sure that we do our best to commit, the basic rights to children, and we make sure that we exhibit the COVID responsible behavior wherever we go, and also we make sure that we promote it in our network. And that is the biggest responsibility of young people right now in this COVID pandemic period. And we all are committed, and I think the young people who are participating in this conclave are very much committed and inspired by the special talk of Dr. Kamal Kumar sir from NSS, Safin Hassan sir, who has a huge fan following in young people and whom many youngsters admire, and take him as a role model. Lakshmi ma'am from UNICEF Gujarat, I'm very much thankful to everyone for joining. And now we shall be preparing for the next panel. And meanwhile, let us also welcome uh, Dr. Vipul Agrawal, sir. He has also joined us. Hello, sir.
Hello, Madhiji. How are you?
I'm good, sir. Very good, sir. Yeah.
Great to
We
hear.
also
Jain sir,
Uh, Jain Safin, कैसे हो?
I'm fine sir. How are you
Very,
sir?
very fine. Thank you. Great to hear all actually. Good that I joined 20 minutes in advance.
Sir.
Thank you.
yeah,
That's an honor sir.
yeah. We are also having Urvashi ma'am joining for the next panel, Youth for Health in COVID-19. She's from Niti Aayog. Yeah. Welcome, ma'am, to the panel.
Hi, thank you.
Yeah. We also have Mr. Kumar Manish, State Yuva Consultant UNICEF, who is joining us. Welcome, Mr. Kumar.
Yeah, hi. Thanks, Madhish.
Yeah. Thanks. So, yes, I'll play a video and then I'll introduce the panel, Mr. Kumar, and then we switch to the next panel, that is Youth for Health in COVID-19. I'll start the video.
Madish,
Yes.
if I may
Sure,
leave
sir.
the session because I have another event
Sure,
planned.
sir. Sure.
Okay. Thank you so
Thank you
much.
so
It was
much, sir, for
wonderful
joining.
hearing you
Thank
all
you.
and interacting with you all. Thank you so
Thank you,
much.
Kamalkar, sir. Thank you, Lakshmi ma'am. Thank you, Sapin, sir.
Thank you all. Thank you.
Thank you. Yes. We'll start in a while. We are waiting for one more panel member to join.
Madhishji, you are on mute. Madhishji, you are on mute.
Yes, yes. Sorry, sir. Thank you. Okay. So yes, we are live with the panel that is Youth for Health in COVID-19. And as we have seen that globally, we are facing unprecedented crisis in terms of health because of the pandemic. And we have Mr. Kumar Manesh, who is the State Yuva Consultant Gujarat UNICEF, and who will be moderating the panel and also introducing the guests for the panel. Over to you, Kumar Maneshji. And before the panel starts, we are having a special talk by Dr. Vipul Agrawal, sir. Yeah. Over to you, Kumar Manesh. Thank you.
Hello, everyone. Hello. Am I audible? Madish?
Yes, sir. Yes, sir. Yeah.
Okay. Thanks. I think the best thing about this today's session that we're going to start on time, and we started at 3 o'clock with the inaugural session. And 3:30 we're going to start our first panel, which basically is about youth and health. And health we chose specifically because in COVID-19 we have seen the personal and public health situation. Hello.
Yes, we are able to hear you, Mr. Kumar. Please continue.
Okay. So I'm going to start our first discussion with Dr. Vipul Agrawal. He's a Deputy CEO with National Ayushman, and he has been a great champion in terms of youth engagement. While he was in Gujarat, he initiated a lot of engaging initiative with youth to really connect on a lot many social issues. Without any delay, I'm going to invite Dr. Vipul Agrawal to start his special talk, and once he finishes, then we'll go with our panel discussion with all the panelists who have joined from across the country. Dr. Vipul Agrawal, over to you.
Yeah, thank you, Mr. Kumar Manish. Thank you for inviting and giving an opportunity to me to join this forum, because it is always a pleasure to be a part of any discussion where Gujarat is involved, and speaking in a forum where youth is attending. I think it's a pleasure and makes it all the more important. So there's a small presentation that I would like to walk you through. My colleague Mohit, I would request him to kindly put that up. Mohit, if you could share the presentation, please. Yeah, while this presentation is uploaded, I'll just give you a brief on what I am doing. So I am a 2001 batch Gujarat Cadre Police Service officer. I am currently working in National Health Authority, which is implementing two flagship schemes of Government of India. One is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which incidentally is the biggest public funded health insurance project in the world. And we have recently launched the National Digital Health Mission. Honorable Prime Minister announced National Digital Health Mission on 15th of August. And this probably would be the third biggest revolution in digital space after UPI and Aadhaar. And we have started with 6 union territories to begin with, and we would expand and extrapolate, scale it up to the other parts of the country in the early part of next year. So please put in presentation mode, Mohit. Is this a PDF that you've uploaded? You don't have a PowerPoint presentation? Anyways, come to the second slide, please. Mohit, please scroll it down.
Sir, yeah. So he's facing some technical error. So he has shared me the PowerPoint presentation. So I'm running it for you.
I'll share my screen. So Mohit, please put that down. I'll share my screen then.
Sure.
Is my presentation visible? Because I can't see it. I'm also facing some problem. I can't see the presentation.
Wait a second, sir. I'm running it for you. Just a second.
Yes, please. Unable to do that. Madhiji, it is not coming. There's some issue with the presentation. I'm not getting up.
Yes, sir. Sir, I'm trying to run the PDF file, and I'll make sure that it looks like a presentation. So
Yeah,
I'm trying to
that'll
do
be fine. I think that'll be equally good if that comes up.
that. Okay. Okay. Yes, sir.
Yeah, thank you. Yeah, so as I mentioned, the scheme is the largest health assurance scheme in the world. We launched the scheme from Jharkhand on 23rd of September by Honorable Prime Minister. The scheme provides for a health cover of rupees 5 lakh rupees per family on a family floater basis, meaning thereby like one member of the family or all members together can avail a benefit of rupees 5 lakh for the treatments imparted under the scheme. It covers almost anything and everything under the sun in terms of secondary and tertiary care. We are not covering OPD packages in the scheme. The scheme is an entitlement based scheme. That is, the scheme's beneficiary base is frozen based on 2011 socioeconomic caste census database. And we are covering 54 crore, that is 40% of the poorest of the poor citizens of the country. Next, please. So there are three salient features. In fact, portability is the most remarkable aspect of this scheme. We are currently providing the scheme benefits through 32 partner states and union territories, whereby we are providing portability. That is, the state beneficiary or the beneficiary under the scheme can avail benefit across the country in any of the 24,500 odd hospitals that we have empaneled in the scheme. There's no cap on the family size, gender, or age. There was the scheme actually came as a this thing. The precursor was Rashtriya Swasthya Bima Yojana, where there was a cap of 5 members in the family, and because of that, it was seen that more often than not, the male members were able to get benefits, and the females were deprived of the benefits. So we have removed the cap that was there in the scheme earlier, and it also covers any pre-existing disease. So it is irrespective of any or all members of the family might that they might be carrying any of the diseases prior to this like becoming beneficiaries under the scheme. And pertinent to the current discussion of this conclave, we have recently during the COVID pandemic announced the COVID-19 testing and treatment packages under the scheme, and provided a cover of more than 1,000 crore rupees worth of testing and treatment in the last 6-7 months. Thank you. And next, please. It has gone. No longer visible. I can't see that presentation. You're not audible, Madhish ji. Yeah. Yeah. So the various stakeholders. So at the center of our scheme is the beneficiary, and everything revolves around the beneficiary. We have the partners as our states and union territories, because health being state subject. The scheme is being implemented through the union territories and the states, exclusive of 4 states which are yet to join. All states and union territories are our partners. We provide the treatment through a network of private and public hospitals, and the scheme monitoring is being done by district and state level implementation units. We provide the scheme benefits through both assurance as well as insurance models, and there's a combined model of mixed mode. Just like in Gujarat, we have a mixed mode of implementation wherein 50,000 worth of benefit up to 50,000 is being provided by the insurance company, or over and above that, the state health agency, the state implementing unit takes care of the expenses. Next, please. Yeah, so this is the ecosystem of the PMJ scheme. So we have the payer. The payer is the state health agency or the insurer, which in support with the National Health Authority implements the scheme. We have the service providers as hospitals. So we have around 45% private hospitals and 55% or public hospitals empaneled with us. And through an IT platform, they are all linked to ultimately serve the beneficiary. So we have probably one of the best IT systems in place anywhere across the country in any of the government schemes. and we also can boast of the most robust fraud prevention anti-fraud framework, wherein we have roped in the world's best data analytics company to provide the fraud and abuse framework to us. Last year, we launched our quality assurance program, wherein we are providing gold, silver, and bronze certification to our partner hospitals. And we are trying to ensure that our beneficiaries get the best possible care wherever they go. We are also supported by a robust call center, wherein we have around 700 plus call center operatives operating from 4 cities, and they are taking care of the various beneficiary calls and information to the beneficiary at various levels. Also, the call center was our call center was being used for operating 1075 helpline during COVID pandemic. We also have a very robust monitoring and evaluation framework in place, wherein dashboards which are customized to the requirements are giving us real-time inputs, and we are also providing data. And especially during the COVID pandemic, our call center, our monitoring evaluation division provided constant feedback to the policymakers. As we can see on the right side in the Indian map, we are operating on three modes. 20 states are implementing in trust mode, that is the state health agencies are taking care of the entire expenses. 8 states are implementing on insurance mode, whereas the 4 have a mixed mode of implementation. Next, please. So just a bit on the process which the beneficiary has to go through while availing the treatment. There is a pre-authorization required for availing the treatment. The beneficiary's name is there in the database, but to avail the treatment, the beneficiary's e-card or the golden card that we say has to come out. So the beneficiary can avail this facility even while he comes for treatment to the hospital, or before that also through a network of common services center, or when the beneficiary comes to the hospital without an e-card. There's a Pradhan Mantri Arogya Mitra, which is the first point of contact, can generate the e-card. The hospitalization of the patient begins, and the pre-authorization request with the disease and the diagnosis and the package to be booked is sent to the state for approval, and this happens instantaneously. And the treatment and discharge happens in due course, and the entire claim and settlement happens on a IT platform which is entirely cashless and paperless. So this is the most remarkable aspect, that there's no co-payment or any penny to be spent by the beneficiary. And the claim processing also for the doctors is for the hospitals is very, very effortless, and we are providing claim settlement in a TAT of maximum 15 days, turnaround time of maximum 15 days, which is a big relief, and that is why such a big participation from public hospitals has come for the scheme. Next, please. Yeah, so we are providing, as I said, anything and everything under the sun is included. And if you can see the right bottom, there's one unspecified package for surgical procedures up to 1 lakh rupees that we have provided for any treatment which is not covered in under the scheme, and the patient comes with a diagnosis and the patient has to be hospitalized. So the states have a flexibility of booking under unspecified package also. Over and above the base package rates, we are providing some incentives also, as we can see on the bottom right. Next, please. So as I mentioned, we are providing incentivization under the quality certification, 15% to gold certified hospitals and 10% to silver certified hospitals. And since the scheme, the certification process and this accreditation started, and immediately afterwards we had this COVID pandemic, the numbers seem a bit low, but we have taken this drive has started now to rope in more and more hospitals to provide get quality accreditation and live up to the standards that we expect from them. Next. Yeah, so coming to the fraud analytics, as we can see that we are maintaining two dashboards, two portals. One is the radar, which is for the risk assessment, detection and analytical reporting. We are generating real-time data on the outliers as to which hospitals might be getting a treatment done, which are the patterns of frauds and abuses, and we are pushing this to the state for action. Similarly, the FACTS, or the Fraud Analytics Control and Tracking System, which was developed through the SAS recently, as I mentioned, the world's best data analytics company. So we are providing AI ML capable fraud analytics framework and pushing the triggers onto the states, and the states are taking action on them. So we've been able to register quite a lot of FIRs. We have been able to de-empanel the hospitals and taken action in terms of recoveries in the last 5-6 months, just because of the robust systems that are in place. Next, please. Regarding grievance, we are maintaining a 3-tier system. We have a PMJ helpline 14555 plus district, state, and national level grievance redressal machinery. And we ensure that all our beneficiaries get their response. The response rate is very, very fast, and all the beneficiaries get the grievance redressed at the earliest. We are monitoring at the topmost level, and we are ensuring that not even a single grievance remains unaddressed, and we are constantly pushing the states to act on this. Next. So far the achievement in a nutshell, 12.8 crore plus e-cards issued. We have provided treatment worth 18,300 crore plus. This figure of 1.5 crore, 4 crore plus was breezed up day before yesterday. We are now 1.5 crore plus treatments now. Today, Jammu and Kashmir USC was launched by Honorable Prime Minister of India, and many of the states are now launching universal healthcare on ABPMJ ecosystem. We have attended 72 lakh plus calls. I have also already mentioned about 45% private hospitals under the scheme. 1.5 lakh portability cases worth around 340 crore plus have been treated in this scheme. And most remarkably, females have been able to get 48% of the total benefits under the scheme, which was not available during the predecessor, that was Rashtriya Swasthya Bima, because as I mentioned, there was a cap on the family size. So we are being able to be gender neutral in terms of our treatment. We are also running a mobile app with more than 20 lakh downloads. And the top specialties which have been booked are under general medicine and surgery. Next, please. So we can see the graph. There was as expected, there was a dip because most of the hospitals were shut down and the patients were not coming for treatment for regular elective treatment. So it gradually and slowly it built up, and now we in fact are seeing a dramatic rise. Last 2 months, there has been a sharp increase in terms of pre-authorization and the treatments that we have booked under the scheme. In fact, we have surpassed the pre-COVID numbers now, and slowly, each day we are seeing new figures coming up, and with more and more states joining us. In fact, Delhi has recently shown interest in joining us, so we'll be having much increased numbers in the coming year. Next, please. So coming to NHS response to COVID-19, we have been able to provide more than 1,190 crore rupees worth of treatment so far in the last 6-7 months. We have notified 64 packages for treatment under COVID, and we are also supporting state governments in engaging the private healthcare providers. We have empaneled more than 5,000 hospitals in the last 5-6 months. So that and majority of them have been private hospitals. So that cannot be called any less than an achievement, because with 50% of the healthcare providers shutting down, and empaneling 5,000 would mean somewhere around 10,000 in the non-COVID times. It was very, very difficult, but the teams have supported, the states have supported, and because of that, we've been able to tackle this challenge. Call center, we have, as I mentioned, 1075 call center has answered more than 38 lakh calls. We also did verification of the data which ICMR received, and we made 31 calls to the high risk group based on this data. Many of the old age group might have got calls which were placed through our call center just to give COVID guidance related to the precautions to be taken during COVID pandemic, which was done by NHA. We also validated the data which was provided through Arogya Setu app, and we made more than 20 lakh calls to the various risk groups. We also, during this pandemic, launched the hospital empanelment light module to take care of the issues in hospital empanelment, the red tapeism, and we fast-tracked the hospital empanelment, and because of that, we were able to achieve this number. We also modified the IT system for providing treatment to non-ABPMJ beneficiaries by launching a health benefit package light version, and which yielded a great result to us. Next, please. So way forward, just a bit, one single slide on what we are contemplating and intending to achieve in the days to come. Next slide, please. So we now are in the process of converging the various government schemes into one platform. So the thought process is that the health coverage, especially even in the government sector, is quite fragmented. We have schemes like CGHS, we have scheme for all the ministries for the beneficiaries, which are running separately, and with there's no data generated through those schemes. We are not being able to do a demographic mapping of the beneficiaries in terms of their risk profile as to which how where and which kind of pandemic can occur in future. So we are in talks with Ministry of Labor and Employment, Ministry of Road Transport, Ministry of Social Justice, to converge the schemes for their beneficiaries into onto NHA platform, and that is going to be launched very soon. Even for the Central Armed Police Forces, I think on Union Home Minister might be launching some scheme for which we have prepared our IT system for 30 lakh plus beneficiaries under the Central Armed Police Forces, all 6 forces. There's a talk going on to converge on all the national health programs on a single platform. It is in very preliminary stage. We are in discussion with the Ministry of Health and Family Welfare. So this would give us a chance to do collective bargaining also. When we have a bargaining capacity, all the beneficiary base covers onto our platform, and all the hospitals converge. So we would be able to do a much better bargaining for the medicines, for the equipments, and I think we might be able to save much more of public fund if we all converge on a single platform. ESIS pilot also is getting launched in 4 states in the coming month. Next, please. There's another issue which remains to be addressed even after PMJ and all this convergence. So as Niti Aayog, and there's a member from Niti Aayog who's attending this, she might be able to comprehend this much better. We have Niti Aayog coined this term of middle class, missing middle, which is the middle 20% population of the country, which is not so poor as government needs to have a free insurance for them. At the same time, they're not so rich that they don't have any effect on their pocket if they spend on the treatment for themselves or their family members. So for them, we are in talks with the various insurance companies, private insurance companies, wherein we can provide our IT platform, we can provide our experience, expertise, and the network of hospitals and the experience that we have gained by running our packages to launch very low-cost products for the middle-class population. For example, I would say that a scheme of and the nature of ABPMJ might be costing somewhere around 20,000-25,000 rupees premium per year for a family. But we are trying to have that scheme launched at around 900 rupees or 1,000 rupees a year for middle-class population. So I think there'll be a big relief to the citizens of the country if 20% of that middle population can get 5 lakh rupees cover in a cost of 500 rupees, 1,000 rupees, or 900 rupees, something like that. Because we as NHA are spending around 900 rupees on an average for 5 lakhs. So if we can do it, I think private insurance companies also would be able to do that. Next, please. So thank you. Thanks again. I think I've taken slightly more time than allotted to me. And thanks again for giving us chance to be on this August forum and speak to the youth. It is always great coming back to Gujarat, and you've invited me. I really would like to thank you from the bottom of my heart. Thank you very much. Mr. Manish, you are on mute. You are on mute.
Sorry. Yeah, thank you so much, Dr. Vipul sir. I think this mute unmute thing is the real challenge these days. But I would love to tell our audience that Dr. Vipul was a medical doctor, and then he turned into a cop, and we will able to see the passion which he was able to explain the whole process. And I think this is very important looking at the public health scenario which we are having in the country. So thank you once again, sir, for not taking your time and explaining this whole process. We have also a public policy expert, and I think he will dwell more on it, how these policies gets prepared and where youth can play an important role. So on this particular panel, we have brought a mix of individuals, one public policy. We have someone who's a doer, who started running a startup and impacting the lives of the young children and the teachers also involving in her startup. And then we have Dr. Manan. He is extensively working on mental health, and he will talk more about the mental health scenario in the country and how it can be improved in the context of youths. Before any delay, I'm going to go directly to Urvashi. And Urvashi, you have been an expert in public policy, and you have been working in the area of WASP, gender, and lot many other. So according to you, how do you see the current situation from the public policy perspective? And also, how do you see the youth can be a part of this whole public policy formulation? Because for many of us, public policy still is a something very, very complicated thing. So if you can explain or just tell your experience about it. Over to you, Urvashi. You can unmute and.
Yeah, thank you. I hope you can hear me.
Yes, madam, you are audible. Please go ahead.
Oh, okay. So yeah, thank you very much for inviting me for this discussion, and it's a very important topic on the engagement of youth, especially in India's health sector. So I think I would just make some brief remarks. It's obviously a very broad topic, but I'll focus really on the youth and where the youth can come in. Now with India, historically we've been a very cure focused, a very hospital based health system. Now, of course, you need hospitals, and we've heard in the presentation how important that is, how many life saving treatments have been provided already under the Ayushman Bharat program. So obviously, there's no denying that you need secondary and tertiary care, you need hospital-based care. But for such a large and diverse population, where we are plagued with all sorts of issues. On the one hand, we still have the traditional maternal and child health issues. We have communicable diseases. On the other, we have a huge burden now and rising burden of the non-communicable diseases. So heart disease, diabetes, and a lot of these cancers, a lot of these result from risk factors which actually begin in youth. The recent National Family Health Survey has shown that it's not just about undernutrition that we are dealing with in India, but we're actually also dealing with overweight and obesity. So India is sort of going through this transition. There are demographic shifts, there are epidemiological shifts. And because of this, it is very important that we move towards prevention and wellness, because we simply cannot afford to have so many people falling sick, no matter how many hospitals we have, and no matter how good quality they are. We simply cannot manage given the size of our population. And it is also not the right approach from a health system perspective, because when you have to treat somebody with a more advanced disease, it's also more costly for the health system. And obviously, the outcomes for the individual are likely to be as good as well. So, this is a very, very important area where the youth can really take leadership in moving India towards wellness, towards fitness, and looking at health not merely as absence of disease, but actually overall physical, mental, psychological well being. So I think that's a very, very important issue. And that is an overarching sort of goal for our health system. And I think hopefully after the COVID-19 pandemic, it has become even more evident to all of us that public health is very, very important. And there's no substitute for a strong public health system. And specifically on the youth, I would just say that there are a lot of issues which youth in India are dealing with today when it comes to health. Traditionally, when we talk of youth, we just talk of the sexual reproductive health issues. Of course, they are very important, but there's also substance abuse, there's accidents, there's, as I said, risk factors like obesity developing very early on, which then lead to other cardiovascular disorders, diabetes, etc. So there's really, of course, we have a lot of government programs which try and address these and focus on improving the health and well-being of youth. Mental health is a very, very important and rather usually rather neglected aspect in our health system. So it's really, the government is of course implementing all of this, but there's also a great opportunity for the youth to come forward, to take charge and to take ownership of some of these issues, and really focus on their well-being, focus on their fitness, and not just wait for something to happen and then react. So I think if that change can come about, it will really be transformative for the country.
Yeah, thanks, Urvasi. I think valid point about preventive healthcare and wellness, and I think youth has to play an important role. And we are witnessing the sedentary lifestyle and how it is impacting the youth in the country. And I think rightly mentioned that government can't alone do all these things, and that's why we also have a young entrepreneur, Priya Prakash, and she has running a very successful startup, and she has impacted more than 2.5 lakh of students. So I would love to go to Priya and. So Priya, you have been working in this particular sector. So what's your observation on the health condition, especially with the young children, because you are working with them? So what are the real challenges which you see on the ground, and how you are making some differences in their lives? Over to you, Priya.
Right. Thank you so much. I hope I'm audible and everyone's able to hear me.
Yes, please
Yes.
go ahead, please.
Am I audible? Okay, great. Thank you so much. So first of all, thank you for inviting me on this panel called Youth for Health, because that is something that personally I have dedicated my life to. And, being a part of the youth, the millennial generation as well, I echo a lot of the words of Urvashi, where she was talking about that we always talk about curative, but it's very difficult for us to talk about preventive. And, I think Urvashi has spoken really well about what are the preventive, needs for the country right now and why we need to start early. But just to touch a bit more upon that, India has a dichotomy of sorts that we're living with. We have malnourishment. We also have children who are overweight and obese. In fact, 14.4 million children across our country are overweight and obese, right? So we are facing a dichotomy in the same country, and this is something very, very difficult to deal with. Unlike a sickness or unlike something that happens to us, once our health worsens, which can be fixed by going to a hospital or which can be fixed by a medicine, when it comes to preventive care, when it comes to us dealing with our health, whether it is getting ourselves healthier. We are at the end of the year right now. January is coming up, and I'm sure there'll be millions of Indians out there who are going to be making a New Year's resolution. But the fact is that it's very, very difficult to change things which are more behavioral changes over a period of time, which is why it needs to start at a very, very early stage for us to really start thinking about prevention. And it's not only physical. Physical is a challenge in itself. If anybody here listening who is a youth has tried to start working on their physical health, you know how difficult it is. I myself, when I was a child, struggled through my own physical health issues, physical and mental. And it took me years to reverse some of the issues that I had. I was overweight as a child. So it was very difficult for me to change my habits to become who I am today. And just like me, there would be a lot more children out there in schools, who are growing up, their bodies developing, and they don't have guidance from either their school or their parents. And we never learn in school about what it means to be healthy. And it's not physical health, like I said, it's also mental health. So currently 10% of children and youth age 15 to 16 years old have a clinically diagnosable mental health condition, but yet 70% of these children have never received any kind of support for it. And I think this raises a lot of questions from an ecosystem perspective, right? What is the ecosystem around us that is enabling this to happen? Now, the ecosystem comprises of a variety of actors and stakeholders that are part of this. Of course, we can all say that prevention starts at home, that parents are the ones who should be taking care of the health of the youth, of the children of today. But as we know that it's not very easy for even those parents to have access to good resources and education for them to take care of their children. So what can the other ecosystem players do? Now, if we talk about the government, I think we heard a lot right now about the Ayushman Bharat scheme. And as Urvashi was touching upon, there's a lot of focus on cure, but we as a country cannot afford to keep on spending crores of rupees on curing things, on people going to hospitals. We need to focus on prevention. So what can the government do to support preventive initiatives? I think that is something that is a huge question that we need to focus on. How do we support and fund preventive initiatives? Because right now, maybe youth like me, people around who are trying to take up initiatives, who are trying to run organizations which are focused on prevention, what is the support for us? So that is the first question that I would say governments do have to address. Secondly, in other countries around the world, preventive care is a part of insurance. So if you look at mental health is a non-communicable disease as well. That should be covered under insurance. Every citizen of India should have the right to a health checkup every single year, which should be covered under insurance. If we do these things, I think we do have a shot at prevention. But unless we do this, unless insurance recognizes prevention as a key aspect, it's very, very difficult for us to take any concrete steps, which is why the government has to come in on this as well, is my suggestion. And when it comes to education, so Health Set Go as an organization, we have been working with schools across the country. We have worked with 2.5 lakh children across the country within schools to try and create a health promoting ecosystem. Yet, it is not mandatory for schools across the country to have a health checkup every year for their children. It is not mandatory There is a guideline, but it's not mandatory to have a psychologist or a counselor within schools. These are things that the government can play a huge role in. Of course, youth like me are going to step up, are going to have initiatives. But when it comes to regulatory and policy perspective, CBSE board, ICSE boards, governments, insurance agencies, these actors have a lot of role to play. And this is how we'll be able to empower parents, schools, children to lead healthier lifestyles going forward. So these would be my recommendations. And I really hope that as an organization, like Health Set Go, there are more companies coming up in the preventive healthcare space for younger people, for the youth. And for this to happen, we need to see these changes in our country.
Thanks, Priya. And I think we'll go back to later on to Urvashi to respond some of the questions regarding the policy on how we can ensure these policies exist at the school level. And I think most important factor, which you mentioned about the mental health missing from the insurance scheme, if that can be done on a more faster manner. So I will go to Dr. Manan. He's an expert psychiatrist, and he has been the youngest TEDx speaker as a doctor. So Manan, and I think both the panelists mentioned about mental health, and you coming from the same field, and we have recently seen mental health during the lockdown scenario. There were a lot of issues, and we have seen celebrities having issues, and we have seen a lot of controversies around it. So how do you see the mental health scenario, especially in the context of youth? Over to you, Dr. Manan.
Good afternoon, everyone. Thank you to Gujarat Youth Forum, Kumar, Manish, Madhish. You guys have been doing some great work in the field of creating awareness about, as far as policy regarding a lot of relevant issues is concerned, bringing all the stakeholders together on one platform. I can imagine it's a really difficult thing to do. And I really appreciate the work that you're doing. And I appreciate the opportunity for a psychiatrist, for a mental health expert to be on a platform like this, which means that mental health is now being discussed. That itself validates that idea a bit, I guess. With the current COVID crisis, there have been a lot of wake-up calls that we've got, isn't it? This year has taught us to not take a lot of privileges for granted. We all had our coping mechanisms when we were stressed. Some of us like to go out and discuss with friends. Some of us like to go out and watch a movie when we're stressed. Some of us like to hang out in our favorite garden, go for a walk. All those privileges that we took for granted have now been attached to a value, attached to a certain timeline, attached to a lot of things which limitations that we didn't think would exist. The fact that we would never be able to go to a multiplex or a stadium and watch our favorite cricketers, watch our favorite movies, was an idea that was kind of unheard of, and that really brought about a lot of crises as far as the mental health is concerned. So we have seen, along with a physical health crisis over the past 7-8 months, we have seen a lot of mental health crisis. And if you see any objective data as far as the past 7-8 months is concerned, so the incidence of issues like depression, the incidence of suicides, all have increased over the past 7-8 months, with a lot of notable names in it as well. Having said that, I wouldn't really want to sound really pessimistic, because the awareness regarding mental health, the appreciation of mental health is also increasing leaps and bounds every day in our country. With movies like Dear Zindagi, with a lot of objective communication around mental health, it is something that encourages me as a psychiatrist to look at it in an optimistic point of view as to what India has in store in the next 5-10 years as far as mental well-being is concerned. My esteemed colleague pointed out a really important fact, that health should not be mere absence of disease, or it should not be focused merely on treatment. That is a very, very important point, specifically as far as mental health is concerned. Mental health is defined as overall well-being. The fact that a person knows what his potential is, being able to work towards it and contributing towards the society is what the definition of mental health is. So it isn't really just absence of depression or absence of anxiety. It is being in a positive state of mind where you are able to contribute actively to the society that mental health comprises of. And that is why it shouldn't really be focused only around treating. It should be focused around a mental hygiene, like we have we brush our teeth twice a day. We make sure that we get a bit of exercise, we get a bit of yoga every day. Similarly, it is very important to make sure that we've taken care of our mental health daily. We have the right to be happy. It's as simple as that. We have the right to be happy. We're seeing a lot of new progress being made in the field of mental health internationally. If you see, the Australian cricket team recently hired a full-time mental health expert. Our Indian cricket team had Paddy Upton, who is, if some of you guys do follow cricket, who is a mental health coach. He was a very, very integral part of the Indian cricket team when Gary Kirsten was our coach. So a lot of progress is being made as far as mental health is concerned. And I would like to again reiterate and second one of the opinions that my colleague has said, that mental health, the new Mental Health Care Act that we have right now, which is being implemented, is again an indoor or an admission policy only. We don't really have therapy sessions which are covered in insurance scheme, be it government or private in India. So therapy sessions being covered under insurance, more and more awareness on such platforms, I guess, is a very, very important step for me to underline. And I would be doing injustice to my job if I don't underline that on this platform.
Hello. Yeah, thanks, Manan. So I think I will go back to Urvashi because both the panelists had mentioned about the policy related to mental health. So from the policy point of view, Urvashi, what's your take on making it, like especially in the context of the school, what we needs to be done?
Yeah, so I think there's two parts to it, as I was touching upon briefly earlier as well. One is the prevention part, the early detection, the primary care level sort of initiatives, and of course, the government does keep introducing a lot of initiatives there. The other pillar of Ayushman Bharat, in fact, is supposed to be these health and wellness centers, which are set up very close to where people are and where you have some of these basic preventive and promotive services, and they should also link up with other government setups in these areas, so like schools, like the Anganwadi centers. So that is sort of the ideal design of how they should function. Now, where we often end up faltering in the health system is not the shortage of the ideas or the policies per se, but the funding to back it up. So the health sector for decades has been chronically underfunded. Every time we have some crisis, we talk about the health sector, we talk about funding, but that's not how it works. You don't become pandemic ready overnight. You don't suddenly solve such big issues for such a large population overnight. Over years, you need to invest in this sector. So it really comes down to every single government. People often make this a political issue, but as a public health person, I always say that every single government which has the opportunity to invest in public health but chooses not to is actually really costing us very, very heavily. And that's the price we end up paying down the line. So very first is you have to increase funding for this sector. We are just way too low when it comes to funding. And the first charge on that funding has to be public health, has to be preventive care. Because you have to remember that public health anywhere in the world is primarily the responsibility of the government. It's not a sector where the private players can do too much because there are market failures. Yes, the private players can provide secondary care, tertiary care. They can come in for certain aspects. They can help on your pharmaceutical sides, on your medical devices. So there's many efficiencies. There's a lot of scale that private players also bring in, but public health is really around the world the primary responsibility of the government. So the very first sort of step for us in order to make these policies that we have on paper, and on paper are quite robust really, into realities, is to put in enough money, not just at the central level, but also at the state government level. The other is our human resource capacity. You can have these health and wellness centers, you can have the brick and mortar structures, but if you don't have trained personnel to actually run these, and by trained personnel, I don't just mean doctors and specialists. Of course, we need many more of those, but also your nurses, also cadres like nurse practitioners, allied health professionals. We have really neglected all these cadres again as well. Whenever we talk of personnel, we think, oh, it's just doctors and it's specialists. Of course, you need them. Again, they are critical. but you also need other cadres to work with them and to support them. So I think those are two very important fundamental measures which prevent us from implementing our public and primary healthcare programs, although the concepts are there. But until we put in the funding and we put in the human resource capacity, it's not really going to become the reality. And the other part is on the Ayushman Bharat, the insurance itself. Of course, we have been trying to look at and make a case that even outpatient procedures at least should be covered under this. So, then if you have visits to say a psychiatrist, or, you have some outpatient kind of interaction, that should also be covered. It should not just be inpatient hospital admission. So we have certainly been advising that from our end. We've been looking into that. And how that can be worked out, how the packages can be made much more comprehensive, can include a variety of conditions that people are actually facing. So hopefully that is a next step of evolution that some of these schemes will take. But as I said, if we want any of these schemes to be truly effective, we have to put the money where our mouth is. We have to put in the money, and we have to train the human resources. Only then will we get the outcomes that we desire.
Thanks, Urvashi. I think you have been very candid in expressing the point, and especially as you rightly mentioned about we have to focus more on the health first, be as an individual at the government level and both at the center and the state level, without having any political angle to it. So that's a very welcome thought, and we hope that we should work in that direction. I think COVID-19 has given us the opportunity to really work in body and spirit to really make ourselves more a healthy nation. So I will go back again to Priya Prakash, and because you have been an entrepreneur and you have started your initiative, you have been awarded at national, international platform. So someone who wants to start in the sector, in the wellness sector, or health or wellness sector, how should one start? What are the things which they can learn from your own experiences? Because when you started, it must be a difficult time getting a schools to be on board with something which they have never thought of. So what's your advice to a lot of people who might be a potential entrepreneur?
Yes, sure. Thank you for that question. But before I get into that, I do want to, touch upon a pillar that, Urvashi has very well said about the funding that is required. But I think a very, very easy to pull lever from a policy perspective, which does not require funding, is actually encouraging market-based models out there. And I'm talking about the rise of today, the social enterprise. I think nowadays the youth, if you ask any of the youth, maybe in a different generation, their inclination towards doing business for good would not have been there. But if you see today's youth, there is huge rise in that youth age group of people willing to start social enterprises. And when you club a market based model, when you apply a market based model to a prevalent problem, there is a huge potential to solve that problem. But what might prevent and this goes back to your just asked question about what are the struggles that me as an entrepreneur faced when I was trying to do something in preventive health, is because I would say that there aren't policies to back this. And unfortunately, when I was starting my journey to say that schools in India should be health promoting, I was always told this is not our job as a school. Our job is to educate, and everyone is very, very stringent about compliance. So when it came to the size of the classroom, the availability of a washroom inside the school, various other things that the government asked for, policy asked for, CBSE asked for, those were the requirements of a school. But when it comes to, and in India, if you see, there are two categories, right? Of course, there's government public schools and then there's private schools, right? So again, there are levers that you can have separately for both of them, because you do realize that government schools might require that public funding that Urvashi was just referring to. But when it comes to private schools, or when it comes to some of the policies that we can have for schools like that, there was no policy or guideline for them to have health as an integral part. It has always been a suggestion and not a mandate. And when that happens, it is very difficult for people to start organizations or ventures in this field. simply because we just have to keep explaining ourselves as to why is this important, why is preventive health important, and it becomes very difficult. And that is what I faced, like you said, I must have faced some challenges, and these were the challenges. Of course there are the challenges of starting a company, but those challenges are nothing compared to the challenges of trying to convince people about the importance of a subject. And instead of trying to convince people about the importance of mental health, physical health prevention in schools, I think this is something that, if we are helped with in terms of policy, it does not require, and this requires probably very little investment in the existing government things. It's more about the changes that can happen, which encourage these market based models, so that happens from a private sector perspective, and it's not looked as, okay, private sector, not a good thing. But there are, what I say, social enterprises, many of us who want to do good and want to start businesses and can be supported from a policy perspective. But since let's say that support sometimes is not there, especially in mental health right now, I think it's a big struggle again explaining people why is it important, why do we need to focus on it, why do you have to spend on it. Let's say, there's a big issue. The only advice that I would give to anybody starting a social enterprise or starting their organizations in a preventive health space is, one is, you require a lot of patience and perseverance. Don't give up when you come up with an idea that's not only, that can't that not only creates value monetarily but is also good for your country. I think you should definitely go for it. Try to have a business model that embodies your vision and mission and has a market. And many times you might have to create that market. You might have to go and convince your customers and users, why is this important, why do you need to have sustainable products, why do you need to conserve, why do you need to focus on health. There are a lot of startups doing this. But have that patience, because we are not there yet as a country where it's a widespread accepted thing. I think, like Urvashi said, it takes time. So invest that time in it. When you start, it might take a few years, but just keep going. And I think once you start doing that, you have early users, early adopters, early consumers. They will be the ones who are vouching for you. And I think that is something that has worked for me. For all the young people, sometimes even women, a lot of young women I see are starting off their own organizations. And I think it's a very proud moment for the youth to use these market based models to create a change for good. So my number one advice to you would be patient, don't give up, and keep going. And this is a decade, 2020 to 2030 would be a decade for youth-led, business for good ventures. And so I'm really looking forward to that. The more of us that are there, the better it is for our country.
I think thanks, Priya. That's really a great motivation for the people who are watching this particular conversation. And the most important factor which you mentioned, the next decade, is about youth and for the youth. So again, I will go to Dr. Manan, because Priya also mentioned about the mental health and this whole idea of being judged or mental health as a taboo. How do we need to address it? And I think more and more youths are getting affected, and we are seeing that they are also not able to express. We are also witnessing the cyberbullying and body shaming. So there are a lot of things which are emerging. So how do you see, from the parents' perspective and also from the youth perspective, how should we break this ice where we can easily talk about mental health issues without being judged? Over to you, Manan.
Thank you, Kumar, for that question. It's a very relevant one, isn't it, given the current state of affairs? I think the major hurdle that one faces as a mental health professional in our country is explaining the biological nature of mental health. We're all completely all right taking treatment for malaria. We're all completely all right to make sure that we apply Odomos so that we don't get malaria. Taking preventative measures as well as curative measures for malaria, we're all right. We have also become all right with checking our physical health, making sure that we get our hour of exercise or our 10,000 steps to make sure that we're all right in physical health and we avoid issues with physical health like, say, diabetes, hypertension, obesity. But we do not still completely accept the idea that mental health is as biological as any other issue with the physical health is. And this is not an issue which only people in who are not belonging to the healthcare sector, even as psychiatrists, you can go to, one thing is that we only have 4,000 psychiatrists in our country. So that, well, is a point to start in itself. And you go to any of the 4,000 of us and ask us as to what are the major conversations that we have with our colleagues in different fields, and that is to explain the biological nature of mental health. Science has grown leaps and bounds. We understand mental health and depression and anxiety as much as we understand diabetes today. But still, most of the people feel that all we do is give sleep medicines. If it was about sleep medicines, it wouldn't take 8 years to get this degree. So understanding the biological nature of illness is, or the biological nature of mental health is the major hurdle that we as mental health professionals, psychiatrists, psychologists, people who work in the field of mental health, I think the day people start believing in science is when superstition or judgment takes a back step. So the way to abolish a lot of judgments and a lot of, like previously, leprosy, chickenpox, these all used to be considered in our country as punishments for the paps that you have done, for the sins that you have done, and that is why you get leprosy, and that is why you get chickenpox. And then education happened, and people got to learn that it is because of a bacterial or a viral infection that it happens, and then the people started respecting it. So knowledge or education is where it starts. And I think platforms like these, platforms like Gujarat Youth Forum, where we are discussing mental health, where I guess one person today might hear and feel a little bit more comfortable talking about their mental health to their parent, is an achievement in itself. So that, I think, is where the first point is. And it's very essential for us to democratize mental health this way. I, as a psychiatrist, should not be greedy and say that, no, mental health is only my purview. I should be open enough to discuss it with other colleagues, other professionals, and make sure that we all get together, because there is a lot of room for a lot of work to be done. So democratizing mental health, making sure that the education aspect of mental health is given responsibilities to the teachers in the schools, teachers in the colleges, using art to promote mental health is going to be a major frontier as far as the next 4 or 5 years is concerned. And we as a society judge behavior a lot. We don't really think about the thoughts that a person has and the feelings that a person has. We judge as to how this person behaves in front of me, but we don't really get into why. If we start going into why, if we start getting into the person's thoughts and the feelings, then our judgment will be a bit more reserved and a bit more lenient, I guess, towards them. So I guess these things are very, very important. Obviously, yes, I completely agree with the fact that we're short on healthcare professionals, we're short on budget. Definitely, our healthcare budget spends less than 1% on mental health, which is one of the most strictest or the least amount of money that any country spends on mental health, unfortunately. So yeah, we do have budgetary issues. We do have healthcare professionals who are also very much short on supply. But at the same time, India does have the opportunity of unlimited data. Just the fact that the next policy being executed is digitization of our data and digitization of healthcare is a major step. And if executed properly, this will solve a lot of issues, because all our records, all our studies, all our healthcare records, including mental healthcare records, will be digitized. What that helps us do is that helps us better the science, because then we are able to study all those data, which right now, if you see data regarding mental health, a 200 patient study is a beautiful study. Whereas imagine a country like India, where we have digitized records, and if we do it ethically and if we do it rightly, India has shown the way as far as the COVID crisis research and science is concerned. So I'm really optimistic and looking forward to how this new revolution as far as policy and digitization of data takes us. I'm really optimistic about mental health in India.
Thanks, Dr. Manan. I think we have last 3 minutes, so I will again go back to Urvashi. This is regarding we might be witnessing a lot of COVID hesitance and COVID eagerness, and as the country move towards the COVID vaccination program, and you've been a core team of the government of India in terms of COVID pandemic. How do you see the youth role can be in the aspect of COVID vaccination planning, which soon to start in the country. Urvashi.
Yeah, I think one major role that youth can play is obviously to spread the message once we have this vaccine. Of course, very first is that we need to go through all the science and have this vaccine available. But once we do, to sort of get the message out to people who need to get this, because the government has obviously got a priority list. And it will go as per that. So apart from, of course, the health workers and the frontline workers, there are elderly, there are people with comorbidities, including younger people. So these could be people who are not actually senior citizens, but these are actually young people who might have very severe diabetes, or might have very severe hypertension, or they might have a kidney ailment. And so the message needs to reach these people that they will also be eligible for vaccination fairly soon. They will also be one of the priority groups. So it's important that the message goes out, that they should not feel invincible. Of course, now we don't have as much panic with respect to this disease, which is very good. But we should also not go to the other extreme of sort of thinking that, okay, nothing will happen to any of us. We're still losing lives to this virus every day. So it's important that it's sort of this mix of caution, but of course moving ahead with our lives. So once the vaccine becomes available, getting the message out in the families, in the communities, making sure that people who are vulnerable and who are a priority for the government do come forward and do get this vaccination. Because vaccinations, remember, there's a lot of myths, there's a lot of misconceptions. Social media, one person has a side effect somewhere, and suddenly it goes viral on social media, and everybody can say, no, it's not safe, let's not get vaccinated. So the way the message spreads very quickly these days. So it's very important that some of that is countered, and the positive messages also go out, in fact go out in a stronger manner, because obviously the government is going to take all the necessary precautions. But yes, it is a new vaccine, it's a new disease for all of us. So of course there could be certain side effects which are unexpected, because a trial setting is very different from the real life population setting. But that is why all this time is being taken to make sure that we have as safe and efficacious a vaccine as possible. So then to get the message out, to make sure people come forward, that I think will be a very, very important role that young people can play. Because often there's inherent sort of views and biases against vaccination, and this will actually be India's first large scale adult vaccination program. Remember, we mostly have vaccination for maternal and child health. So this will be a large scale adult vaccination program. So I think there's a great opportunity for young people to sort of come forward, to engage with their families, to engage with their communities, and to really make it a success. Because just the government doing things on the supply side will not make it a success. We obviously need that sort of partnership with the communities and with people as well.
Thank you, Urvashi. I think that's a very valid point. And I think we also have to act like an adult during this vaccination program. And of course, don't spread fake news or misconceptions across different social media channels, because that's really defeat the whole purpose of this whole exercise. So we have to end in next 1 or 2 minutes. So that's why I'm going to give 30 seconds to Priya and 30 seconds to Manan to give their last remark, and then we call it a day. Priya.
Sure. Thank you so much. It was truly wonderful to be part of today's panel. It was great interacting with Dr. Manan and Urvashi. I think it was a lovely discussion, and I hope that all the youth who are watching today really took a lot from this. Everything discussed was very crucial, and like Dr. Manan was saying, even if one person has learned a lot today, I am very happy for this discussion, and would be very happy if anybody would like to, know more about Health Set Go and our work, to go on Instagram, Twitter, follow our Health Set Go handles. And if any of the youth wants to join in, make a difference in their schools or colleges, please feel free to reach out. As Urvashi said, there's a lot of work to be done during COVID. There's a lot of awareness to be spread about vaccinations and what needs to come in the year ahead. So, we are fully dedicated and looking forward to working with the youth. And thank you so much once again to have me on the panel. Thank you.
Dr. Manan, 30 seconds.
Yeah, thank you so much to Gujarat Youth Forum, to Kumar Manish, to Madish. It was an absolute honor to be a part of this discussion. It was so great to hear to Dr. Agarwal, who's an inspiration to all doctors throughout the country. It was great to share this platform with Urvashi, with Priya. You guys have been doing some very inspirational work, and you're role models in your field, and that really inspires me to work really hard every day. So yeah, I'm really hopeful that such discussions and such platforms are very essential. I'm really optimistic about people having gained some value from today's session, and it's great work that the Gujarat Youth Forum is doing. I'd really like to wish you all the best going forward, and I'm looking forward to listening to more of these sessions and being a part as an audience member tomorrow as well.
Thank you, Priya, Urvashi, and Dr. Manan. And I think I would like to state one thing, that this is not the end. Again, we are going to get in touch with you for the longer duration of time, where you can have like a master class for the Gujarat Youth Forum followers and also an audience. And it'd be great if you can spare some time to talk more in detail. This is just an initiative where we want to touch base. And one thing which is common among all four of us is that the global shaper connection. We are all connected to a global shaper community. So that's another wonderful thing to know. Thanks once again, Urvashi, Priya, Manan. I think you all came and joined and being part of an engaging discussion. And we really look forward to your support, especially in the initiative which we want to do with youths, and not digitally also. In future, we hope to see you in person, and you can take some sessions here in Gujarat. So thank you once again, and it was a wonderful session. And so all these things are going to be on live on our platform. Thank you once again.
Thank you so much.
Thank you. Yeah.
ત્યારે હું મારા હાથ ધોઉં છું.
ઇન્ફેક્શન કંટ્રોલ એ આપણા હાથમાં જ છે.
So normalizing mental health, the same way that we take care of our physical health,
the quick way of then tackling with that stressful situation is to distract yourself.
Around 8 to 9% of the population currently suffer from a common mental disorder.
Recognizing the challenges we are facing, it's a time for generations to come together to reimagine the type of the world we want to create.
યુવાન તરીકે મેં લોકડાઉનમાં જોયું કે આવનાર આફતમાં સંયમ કઈ રીતે રાખવો અને આવનારી પરિસ્થિતિને કઈ રીતે સામનો કરવો.
જે રીતે આપણે તેને ઘડીશું તે રીતે તે રાષ્ટ્રનું પણ નિર્માણ કરશે.
Hello everyone, welcome to the panel.
Yeah, hi, this is Madesh Parekh from Gujarat Youth Forum, and I welcome everybody. First of all, I would again thank UNICEF and Center of Excellence at Gujarat University for supporting the entire initiative of Gujarat Youth Conclave, and this is what we are doing with young people of the state, trying to empower and bring youth voices on a platform where everybody of us can learn from the same. And introducing the moderator for the panel, Youth in Education, we have Monica Yadav, the founder of Respire Experiential Learning, and she also happens to be a global shaper and at World Economic Forum, and she's also a member of the Education Committee at World Economic Forum. I welcome Monica to take a lead from here. Thank you so much.
Hi, Madhu. Thank you. Welcome, panelists, and everyone who is listening to us for the second panel of Gujarat Youth Conclave by Gujarat Youth Forum. And yes, so we are here to discuss about youth in education. We heard about youth in health, and now we will be focusing on education. I would want to welcome our esteemed panelist, Mr. Professor Himanshu Pandya, who is the Vice Chancellor of Gujarat University, Mr. Himanshu Rai, Director of IIM Indore, Ms. Richa Gupta, Harvard graduate and co-founder of Labdya Foundation, and Abhishek Dubey, co-founder of Muskan Dreams.
Hi.
Welcome you all, and I look forward for our discussion ahead. Yes. So to begin with, it also, like, at the end of the year, it's very confusing to where to begin with. We are in such situation now. So 21st century skill was a talk of the town when we started in 2020, and youth of our country was already looking to mold and learn the new education and learn the new skills. And then COVID happened, and COVID had made this situation worse. There is a gap in learning, and now there is also a larger gap in employment. Now, under the shadow of COVID-19, over 1 billion are out of the schools and colleges altogether. And millions of young people who were set to join the workforce cannot find jobs. This is going to affect the young, the one who are in schools, the one into higher education, and one who will be out to get their first job in this year. This is going to affect everyone. As we have understood this virus now, and we are positively on the path to get the vaccine, it's right time that we have this discussion. COVID has been a big harm, but it has also given a very slight opportunity to regenerate and refabricate the way we used to have this education fabric. And this is a very right time to start talking about youth and education. To begin with, I'll want to invite you to have an opening remark about what do you think that what is your take on the future of Indian youth when it comes to education and skills, especially post pandemic? And importantly, how you all are navigating the same scenario within your organization. So I would like to invite first Professor Himanshu Pandya to begin with that how you are tackling this at Gujarat University. Sir.
Good evening and a big and a warm welcome to my dear friend Professor Himanshu Rai. Good evening to all the panelists and listeners, those who are attending this webinar. Monica, you just mentioned that we have understood this virus. So I surprised. I would like to congratulate if you have understood the virus, because the way it is changing, every day, every hour. None of these scientists, at least myself, we are very aggressively working in the laboratory with this particular viruses and like viruses, swine flu, bird flu, Cayman Congo fever, Nipah, Zika, Ebola. We are fighting with all of this in our lab. Our students are working day and night with these people. But then, life must go on, show must go on, and that is how we have to learn from what is happening around, and that is what we are doing, being an academic institution. Let me give you a few examples. Since March, we are closed, and none of these institutions are working in India. Globally, people are just shut down, and they are finding the other ways to learn, sitting at home and sitting in their offices, and they are all the time online. It's not a new thing for all of us. We all remain online, but for other reasons. This is the first time we are online for academics. and it's good. It's good for country that we are, out of 24 hours, at least we spend around 18, 17 hours online for some social media chatting and forwarding and everything. Keeping apart all this nature and practices, what we are doing. As far as the education is concerned, we are 180-degree changed in our practices. Let me give you a few examples in our university setup, which is a classical example of a public state university. We have online classes going on for UG and PG programs where teachers are deeply involved in online classes and students are participating as per their convenience. And these programs are continuously broadcasted through DTH channels and other means of social media and digital platforms. So in a way, it's a changed format of getting education, or the resources what we have. It is adequate to me. I think we have a lot of e-content and e-modules are available to learn and to understand. One can opt for at least out of 5 such platforms what they want to learn and understand. So it's a big Pandora box what opened today for students to learn and to understand their academics. It has many plus and minus points, I tell you, where you lose the actual contact with the teachers and your moderators and your mentors, where you are not physically present before them, but then you have 100 options before you have to understand your education needs. So that is again a plus point, that the same topic you are learning from at least 10 teachers, different teachers sitting in different establishments. Otherwise, a professor from IIT Indore would not be possible for us to call him on the panel of a regular meeting or conventional meeting what we are doing in our institutions. But today it is possible. We can save on times, we can save on resources, and we can make them available. And wonderfully, without any much efforts, they can be with the global arena with these academic platforms. But as far as the teaching, learning, and evaluation is concerned, this evaluation part is very critical, I tell you. We have many platforms available for our teaching and learning, but the evaluation platforms are missing. And the course of this evaluation of the performance of student, it is at a big stake, I tell you. And it's a big problem for all of us. So while everything is available to you on your fingertips, but then the evaluation part is very critical, and I think we need to evolve with this evaluation pattern. Then we'll be able to deal with this academic requirement of students. That's all. We can continue with the question answer if there is further.
I would, before that, I would like to listen from Himanshu from IIM Indore. What has changed, and what do you think is next upon us, sir?
Thank you so much, Monica. First of all, I agree with my good friend Himanshu. It's the second time we've been on panel in the past 1 week that one of the big opportunities that has come out is that we get this opportunity to talk to people who otherwise it was very difficult for us to talk to through panels such as this. And of course, I completely agree with him that this virus is still not known. And I'm not too sure, maybe perhaps it's unknowable. To answer your question, first of all, I think that the future of the youth is still great. The only thing is that they need to take accountability of their own life. And I'm going to talk about that perhaps a little later. But coming to what we at IIM Indore are doing to ensure that things stay in line, one is that we are offering contextually relevant courses. It's not that earlier we did not, but what we are now doing is we are preparing for the future. So in November, I was speaking at a conference where we had about 100 deans from across the world at Ho Chi Minh, and then subsequently again in February in Milan, where we had about 300 deans from all across the world. And one of the things that we agreed upon in both the conferences was that the pandemic wasn't there, but the post fourth industrial revolution world was upon us, whether we wanted it or not. And therefore, the kind of skill sets which would be required in this post fourth industrial revolution world are going to be very different from the ones that are required today or the ones which are being offered today in terms of academic programs. For example, what the post fourth industrial world would require is complex problem solving, complex decision making through critical thinking, collaboration, both virtually and otherwise, emotional intelligence, negotiation skills, big data analytics, artificial intelligence, and machine learning. And therefore, what we at IIM Indore are doing is that we are either offering courses wherever we have the capability to, or we are providing certification for our students so that they're ready for this world which is coming to them. So that's the first part. The second part is that we are trying to democratize education, which means we are also trying to reach out to those who have not managed to make it to IIM Indore by using our virtual learning program. So we have a virtual learning program platform, which we have now strengthened. We have also gotten into partnerships with certain academies, with a partner in Dubai. We have gotten into partnership with some platforms over here. And through them, we are trying to reach out to as many youth as we possibly can in the country. The third thing that we are doing is in terms of research, where we are going to actually embark upon a research along with the German Foundation, where we are going to look at what will the industry look like in the post-COVID world. And by virtue of this, so what we are doing is we are bringing a person from the industry, a person from the corporate, and a person from the academia together to actually contribute to book chapters. And that book will actually be for the youth of tomorrow to look at and then see as to what is the kind of a world that would be expected and therefore prepare themselves accordingly. And finally, and very importantly, we are also trying to create an entrepreneurial ecosystem. And for that, what we have done is we have actually established an entrepreneurial track within our MBA courses. We have actually converted our incubator into a Section 8 company, and we are trying to incubate ideas there. And we are building partnerships. So we have a partnership with IIT Indore, where a person, if wants to incubate, can actually go for technical help there and can get managerial as well as mentorship from us. We also have a partnership with Gujarat University, since the university system brings in another set of complementarities. And therefore, I think what we are doing is that earlier we used to look at partnerships only with institutions abroad. We completely ignored the synergies that could be had in this country. But what this pandemic has taught us, it has brought the country closer, the institutions within the country closer. And I think through these four things, courses, research, entrepreneurial tracks, as well as making sure that we have good partnerships, we are on the right track. Back to you, Monica.
Thank you. When I say that we know the virus, I honestly meant that we know to sail the way through it, that is mask and taking the proper hygiene there. But of course, we don't know, like the new strain and everything is on the nerves everywhere. I would like to move to Richa. Richa has been working and representing India many places with the work she has done. And over to you, Richa. I want to listen more from you. Thank you.
Thank you so much, Monica, and thank you to all the panelists for being here. This is a very, very important conversation, and I'm truly honored to be a part of this. I think one of the things that the pandemic has very, very clearly highlighted is that school, especially public schools, are not just about academics, something that our policies and the syllabus that we create and the work that we do with children always keeps on pushing. The fact that school is about mental health, school is about meeting with your peers, school is about sometimes escaping domestic violence, violent homes, school is about getting food on time. And I think that is something that the pandemic has really, really brought about very, very clearly for us. And it has made us question what have we been doing with school education, and which I'll be also talking more about. But really in the context of COVID, the people that really, really need us are our children and youth. India is one of the youngest countries in the world. 64% of our children today who go to school go to public schools. Schools that were shut in March with no idea how we're going to do online education, online classes in places where there is no internet, there are no smartphones. And I think that is a big question that really came about when we started off And a little bit context about what I do is my nonprofit Labhya. We partner with governments, multilaterals, and nonprofits to make social and emotional learning more accessible to children across public schools of India. And I'll definitely talk more about that as well. But really, in COVID, what we tried to do was access each child that we could and give them the support that they required in terms of the skills that they required to move on and to really cope with the difficulties and the emotional adversities that they were facing due to the pandemic, by staying at home, by not having friends to talk to, by not having any kind of education. Whether formal or sometimes not even informal, because parents were not at home. And I think some of the things that we did was we supported the government in creating interactive voice response systems, wherein children would get automated phone calls on their parents' phones every evening, where they could do some mindfulness exercises, exercises where they could think about their emotions, reflect on their actions, practice gratitude. We figured out how to send mass SMSs to parents to understand how they can support themselves and their children during these tough times. And more importantly, tried to understand what the children need at this point to cope up. And what we really understood working with both youth and children was that they needed soft skills much more. They needed skills like that would help them build resilience, better relationship skills that would help them understand why school, why learning is important during this time. And a lot of our learnings during these times have come from really listening from the ground itself. Another thing that we realized during the pandemic was how important teacher well-being is. We keep talking to teachers, we keep putting programs that make teachers the center of the program, especially during facilitation. But there is very little conversation around how instructors and teachers these days, especially during the pandemic, have had to pivot in the way they think, in the way they teach, the way they're comfortable creating spaces for children. And so we also launched a program around teacher well-being to really build that sense of community and healing for them.
Thank you, Richa. Great that you are doing such a wonderful job. And Abhishek is from his country, and he was working in bridging digital divide in the school before pandemic also. And I'm sure that it is a tougher job post pandemic, and would want to listen more from you, Abhishek. Over to you. You are muted,
Hello?
Abhishek. Yeah. Abhishek, you're on mute.
Yeah, is it fine?
Yeah, sure.
Is it better? Okay, great. Good evening, everyone. So it's so nice to meeting you all after a long time. Himanshu sir, Himanshu Pandya ji, and Lavya, Monica, both of you. So nice to meeting like both of you. I think the youth is a kind of the biggest part of our country, and I would say the kind of foundation of our country, because in the last 5 years, I think we have been worked with more than 2,000 youth volunteers, and these volunteers and these youth volunteers have a lot of potential to do something on the ground as well as online. Like, we were working with the public school system, right? We are working in Madhya Pradesh. We work with the state government of Madhya Pradesh. So we help them to enable a kind of digital learning in the government schools. Now, but during the lockdown, during the COVID period, what has happened is actually all the schools going to shut down, right? And at that time, the government was not able to understand, what they need to do. So at that time, we almost because we are working with the youth, so almost 300 plus our youth volunteers supported the state government, and with the help of those youth, we have reached out to almost 2 lakh parents by calling them, by making sure that these parents are getting aware and they know, how to use digital resources, how to use digital devices, and especially if parents are, if children are not connected with the teachers, our team is ensuring that they will get connected with the teachers so that they will get learning materials. We'll make sure that parents are aware with the programs, what government is doing for the children during the COVID period. So these kind of support we have done through youth. I think the one, we all are growing with the technology and skills, of course, we'll grow. But I think the one big question during the tough time is very important for all of us is basically the relevance of humans in the 21st century, because we all are somewhere or the other growing with the technology. As Himanshu mentioned that almost 18 hours every day we are going through somewhere or the other, we are connected with the technology. out of 24 hours, right? But we really need to understand, the negative side as well, because I think somewhere or the other we are missing the other thing as a human, which I personally feel, I think, and I have experienced a lot while working with the youth. Yeah, definitely I'll share more thoughts about it, but thank you for now.
Thank you, Abhishek. Thank you, everyone. I would like to now go to a very specific questions. And my first question is to Pandya sir. Sir, the Gujarat University has introduced new generation courses. Within this last year, we have seen that emphasis has been laid on entrepreneurship. There are new courses which are there. And
your voice is broken. I'm not able to listen anything.
okay,
Even the
can you?
previous speaker, I was able to hear only Professor Rai for a few moments, and then the connectivity is lost.
Okay.
Everybody
else can listen to me. Yeah.
Yeah, we
I have
can.
changed this 2 times, but again I am facing the same issue.
Okay. For that case, I'll move to Richa for that, so that you
just
get
move
some time.
ahead to other panelists
Yes.
and I'm through,
Yes.
and come back to you.
Yeah, so that you get some time to stabilize. Yes. Okay. So Richa, thank you for sharing what the work you have done in Labhya, and I understand the workload and the reach which has to happen post COVID must have like totally shattered your planning and then what you did. So I want to know that how do you see social emotional learning as one of the 21st century skill, and what are the best way to introduce this in school and colleges both, according to you? And why do you think that SEL, that is social emotional learning, is a big area to focus for youth? We have been not talking about it, but now it is here and most important in certain times.
Yes, thank you so much, Monica, for that question. It's very important. There are a lot of difficult things to answer there, but I hope I'm able to be concise. And I'm happy Abhishek's here. He's also in the education space. So whatever I miss, Abhishek, it's on to you. I think first of all, let's talk about what is social emotional learning. It's a lot of people have started working on this in India. It's a fairly new space in the Asian context. It was set up in the US about 20 years back. So I think, first of all, in the context of children in India and youth in India, we are really still defining what SEL is beyond the jargon of it. But in very, very simple terms, SEL is the skills that children need to be able to build strong relationships, become more resilient, and really understand what is their role in the larger society and the larger ecosystem that is around them. And so whatever tools are required for children to be able to do that, for youth to be able to do that, is called social emotional learning, something that my foundation Labhya is trying to incorporate within the formal public education space for the past 3 years. And what we have learned over the past 3 years, working with about 2.5 million children, partnered with 2 state governments, Delhi, Uttarakhand, and a number of other nonprofits to reach our children, is that children, this is what they need today to be able to reach their true potential. I was watching the video right before our webinar, and I saw that there was a big letter, big word written over there: youth reaching their potential. And as part of UNICEF and UVA, I know that is something that we all mutually believe in. So I think that is something that we already have established. That is what youth need. And as I also mentioned, we have more than 236 million children today enrolled in public schools of India, schools that only have provisions for academics and at most co-curricular activities. But these schools are not preparing our children to cope with the ill effects of poverty. They're not preparing our children to cope with the ill effects of inequities, and really preparing them for the first job that they're going to get, really preparing them for the future, which is rapidly changing, just like we can currently see around us. And so, in fact, I wouldn't even call it 21st century skills anymore. I think we needed them 10 years back. We're going to need them 30 years down the line. Of course, the definition might change, but these skills are really essential for us to live life. what is the best way to make sure that these skills are a part of institutions like colleges and schools. At Labhya, we truly believe in systems capacity building. We refuse to be a supplier to the system. Us making a curriculum and telling schools to take it and take it and use it is not going to help. But what we do is provide curriculum, teacher capacity building, monitoring, evaluation, and resource mobilization with the governments and partners that we work with. So what does that mean? That means we work with the government to set up a team within the state governments where this is made of teachers, people from the ground, people in the administrative departments, to really come together and talk about what SEL means to us as a system. We then build the curriculum and everything, the entire program, with this team, which stays in the space, in the government, working on the ground. And that's how the curriculum keeps on getting revamped, keeps on getting refurbished. And as a result, every day, a daily 30-minute mandatory class is implemented across public schools in the states that we work with, from grades nursery to 8, where children are able to learn how to regulate their emotions, be more empathetic, understand how resilience works, and decision making and problem solving, and a lot of other skills that we all have spoken about right now. What that does is that makes sure that the system not only adopts something like SEL, which has not happened before in a system like India, but also takes ownership of the program beyond what Labhya is doing, or what the other partners are doing. And I think that is something that is very, very important, because that helps youth and children and the entire system together define what they want from the program and what they want from their school day every day, which is very, very important for us. And your third question was around why are these skills important for youth? I think recently we did a project with UNDP and a Head Held High Foundation, where we were trying to create a web series around soft skills and career guidance mixed together in 21st century skills for young people. And we did a survey in the middle of the program to really understand what kind of mentorship, what kind of guidance young people wanted. And actually most of the students that responded, most of the youth that responded, both in school, out of school, in college, said that they required more guidance around soft skills. And so they were actually not very worried about what their sector options are, all the logistical stuff with the information which is already there, but they were more concerned about what kind of person they want to be, what are their interests, what kind of career trajectory should they see based on their personality. And I think that says a lot about what our youth are looking for today. And these include many youth who were actually going for their first jobs because of COVID, but then had to stay back home for 9 months. And I think that is all in all what the system needs to do according to us, and the work that we've been doing to enable each and every stakeholder in the lives of children and youth to really enable 21st century skills, and to able to give the children and youth the power to decide what they define it as, instead of us telling them what it really means.
Thank you, Richa. Thank you. Himanshu sir, I see that you are back, and I hope you can listen to me now clearly. I wanted to ask you this question that Gujarat University in this last year have introduced new generation courses, hands down to the new entrepreneurship art courses we have developed, and totally new.
I'm sorry. I'm sorry. I'm not able to listen. The voice is still broken, and I'm trying multiple technical aspects. Once it is through, I'll let you know, please.
Sure. Thank you. Thank you so much. I'll move to Rai sir. Sir, higher education. Now, Richa has spoken about what is there in schools. I want to say that how do you see higher education as a whole will recover from this wide gap of skills and job opportunity? And what's your advice to the youth whose curriculum has disrupted in this year, and they might be graduating in 2021? What are your advices to them? And how do you think that digital education will be more accessible in this coming era? Like, digital education, we have got the push, but how it is going to survive? So I wanted to hear your opinions on that.
All right, Monica. So very critical and simultaneously interesting questions, those three. First of all, higher education is going to go through a bit of a change. And as I said, that we have already been discussing it, that higher education is likely to focus on the skill sets which are required in the post-fourth industrial revolution world. What this pandemic has done is that it has hastened that particular process. So which means that we were using a stackable model. So we were stacking up our digital capabilities by adding on to something without having a very coherent digital strategy. And now institutions of higher education will actually need to sit and determine a very coherent digital strategy for themselves. That is number one. I think another thing what this pandemic has done is it has forced higher education institutions to actually redefine their mission statements. So one of the things I've always been talking about after taking over the directorship of IIM Indore is that IIMs have historically not done enough, according to me, for the community. And I think there is a lot of scope for IIMs to be doing more. And I think all higher education institutions now will have to take that particular responsibility. So we started looking at the community around us. We started doing something for the communities. For example, Richa mentioned about teachers. What IIM Indore recently did was that with the basic Shiksha education of Madhya Pradesh, we actually talked to 39,000 primary school teachers, got to know as to what their problems were, and then we created video-based modules that can be actually shared through WhatsApp with 3 lakh of them. So the 3 lakh teachers of Madhya Pradesh from the primary education level are actually going to be benefited by that. The second thing is, as I spoke about, is that institutions will need to look at partnerships. So I keep telling my friend Himanshu that when Himanshu and Himanshu meet, we become a Himanshu square and not just two Himanshu. So you add on, you synergize. I still remember, Abhishek had written to me, and I think Abhishek, you were in Indore. You were coming to Indore on the 6th and 7th of March, and I wrote, and you wanted to meet up, and I told you that, look, I'm in Delhi till the 8th of March. And after that, the pandemic happened, and then we are all ensconced in whatever places that we are. But increasingly, higher education institutions will have to take a more active part, both in terms of teaching, not both, in fact, in terms of teaching, research, as well as consulting, by partnering with other companies, other organizations, and other institutions to make sure that they're also participating in community building, they're also participating in nation building. Now, coming to the youth, what can the youth do? The youth need to, what I call, pace themselves. P-A-C-E, pace themselves. The P stands for purpose and passion. The youth of today needs to find out as to what is it that they are doing and why is it that they are doing whatever it is. Because many a times what happens is that we find people going with a herd mentality. So the job which everybody likes seems to be the job on day zero, and therefore everybody in an IIM would want that. Likewise with ITs. In fact, right at the very beginning, everybody writes either an engineering or a medical exam simply because that's what everybody is doing. And therefore, one of my messages to the youth is, remember, even if you win a rat race, you will still be a rat. You'll probably be the fastest rat, but you're still a rat. So what you need to do is you need to figure out the purpose of your life. You need to figure out what is it that you are passionate about. So I was introduced by Monica as the director of IIM Indore. But please remember, that's my most superficial identity, because that's drawn from a designation that I hold. So, but if one of you really asks me, who are you? I'll say I'm a teacher, or I'll say I'm a mountaineer, because those are the two things from where I draw my passion from. And once you know that this is what you're passionate about, then go about upskilling yourself. And today we live in an auto-directed world. Knowledge is available. You need to figure out what is the kind of a knowledge that you need to take. So that is a P part. The second is the A part, which is accountability. The youth needs to be accountable for themselves. And before you actually start talking about what you can do for the rest of the world, please remember, as Paulo Coelho said in Alchemist, to realize your own destiny is your only real obligation. So the first thing you need to do is look after yourself. Make yourself saksham. Make yourself healthy. Because please remember, if you are not healthy, you cannot make the world healthy. If you are not happy, you cannot make others happy. Once you are accountable to yourself, once you have strengthened yourself, then go about doing something for the rest of the world. And that brings me to the C part of PACE, and that is compassion. Along with passion, the youth of today needs to have compassion. And many a times people actually mistake sentimentality for compassion. Please remember, sentimentality can never be an adequate substitute for compassion. Just because you cry when you watch a movie does not make you a good human being. It just makes you a human being. But when you actually do something to mitigate the suffering of others, that is when you become a good human being. And all of us can do that. I mean, Richa is doing that, Abhishek is doing that, Himanshu is doing that in Gujarat University. For us, for example, at IIM Indore, we put in more counselors. We also started online counseling because we realized that students are restless. They're having a lot of issues. And then because I realized the two calls that I got from two young people who were almost at the edge, and they called me in my personal capacity, and I realized I needed to do something in my personal capacity as well. So I started an initiative in August called Center for Conflict Management under my NGO Samagat. And within 4 months, we are present all over the country. We have about 1,200 people who are joined with us. We are in 5 other countries, and we have resolved about 1,600 plus intrapersonal and interpersonal conflicts. And I'm hoping that we have actually rescued some of the youth from actually going over the edge. And I think all of us need to do that at an institutional level plus at an individual level. And finally, the E part of my piece, the youth need to pursue excellence. Something that I learned from my Tata Steel days. So after my engineering, I worked with Tata Steel for 8.5 years before deciding to shift to academia. And I was fortunate enough to meet the great G.R.E. Tata twice. And one of the things that I learned from G.R.E. Tata was always pursue excellence. In fact, he used to say, aim for perfection, because then you would be excellent. And therefore, my suggestion to the youth would be, use your full capabilities. Use your full capabilities to learn as much as you can. And remember, even if you're a teacher, to be a teacher, you have to be an eternal learner. This pandemic was not the first pandemic. This is not going to be the last one. This is simply a challenge, and we have to face the challenge. And I think all the youth of our country and by our country across the world has that resilience inside them to face this challenge. Back to you, Monica.
Thank you. I like the concept of pace, and again want to very much highlight that youth needs to take the wagon in their hand and have to lead and have to become independent when it comes to aim for excellence. Uh, I will ask Abhishek. Abhishek, I have seen that you have around 150 digital labs, and you have done a lot of work. You have been you have been designated as Forbes 30 under 30, and you have been working on ground with government schools. Digital divide, when we were speaking about that in 2019, had a different scenario. When we speak about in 2020, it's a different scenario, and it will be different in 21 and 22. I want to come to very two specific questions for you. Is that one is that you are reaching out to vulnerable communities, right? How do you think that? How do we can reach to them better? And what are the policies that now government can bring in when it comes to bridging the gap for the digital divide in the schools and the student and the teachers, 3 of them? So policy and how what we can do more for the vulnerable communities. Abhishek.
Correct. Yeah. So I think in the last 6 months, or even more than that, like we are working closely with the government system and helping them in enabling the technology part, the state government basically, and ensuring that how they can actually increase their outreach. Now we can reach out to more and more parents through technology, and making sure that all the children get learning materials through WhatsApp, or the parents will be more aware, so that they will support their child by giving them, smartphone for at least for an hour or for 30 minutes, just to make sure that the child gets learning, by end of the day. I think the beauty of pandemic is basically, before pandemic, we all have that dilemma sort of, now people are actually more open towards the technology part. Now the digital acceptance is increasing, not just in the private life, but of course, everyone is accepting. Even the teachers, even the children, even the parents are accepting, that we can learn, and children are accepting that, they can actually learn anywhere and whatever they want to learn. But I think apart from this, all the positive points we have with the digital learning, but that, at the same time, we have kind of threats along with opportunities. The problem is that, majority of India and majority of Bharat, I would say, the Bharat basically, The majority, 70%, the rural audience do not have any sort of digital devices. The children do not have any sort of digital devices and the connectivity. And parents are not aware, so they don't allow their children to use those digital resources. I think that's the problem. Even you won't believe this, like we were working in the state, and almost like in Madhya Pradesh, we have almost 1 crore children, which is enrolled in the government schools. And out of 1 crore, only hardly 7 to 8 lakh children will, along with government, we reached out to almost 7 to 8 lakh children, just hardly. But yes, devices, the possibility of devices is basically almost 25%, but just because of lack of awareness in the parents and lack of connectivity, internet, and other several costs, basically, through this, like we were not able to reach more and more children. So I think what government needs to do is basically there are 2-3 things. First of all, government needs to ensure that we should have a kind of enough policies on digital, because if you're talking about if we can keep NEP aside, because it's not implementing right now. But before that, only one policy was implementing in the public school, which is the ICT policy by MHRD. And the policy is basically, it's still not working effectively due to, lack of best practices in kind of procuring and deploying this hardware. Because what government was doing is basically just deploying the hardware. They were not more focusing on the building the capacity of teachers. And, if we can, I think, without building a capacity of teachers and making sure that all digital devices are functioning smoothly, it's not possible to implement the digital. And now the truth is basically, the India public schools are failing and not ready for the digital world. And I think this COVID crisis has made all of us, educators, teachers, parents, rethink how we can make learning more inclusive and more intuitive. And I think the future of education needs to be digital friendly. And to keep pace in the world, our school needs to undergo a rapid digital transformation. And that's what we all need to, collectively done, because it's not possible for anyone. I would say not even for the government, because end of the day, maybe they can deploy the hardware ultimately, but it will become fail. So I think the role of civil society organizations as well as the government here, I think that this is the right time. This is the kind of opportunity for all the non-profits to come closer, to come together, to collaborate basically, and see how collectively we can actually create bigger impact, better impact, and meaningful impact, I would say. I think, but giving them devices is actually not a kind of solution, but I think making sure that, what they are learning, how they are learning. But the good thing is basically, the parents are actually involving in the process, but before pandemic, they were not involved in the process. So it's good that parents are more involving, and the government needs to focus. I think once the NEP will start implementing, I think we'll be in better situations with the digital space. And yes, and all the non-profits are doing wonderful job, I would say. And yeah.
Thank you, Abhishek. I also have very high expectations from the implementation of new education policy 2020, and let's see how it goes. So you spoke about what government should do. I would now come to Himanshu sir. He is able to listen to me now better. So what I'm saying is that yes. So Gujarat University has introduced fabulous courses. Entrepreneurship, state of art USEC facilities there. We have best of mentors, we have best of courses now. And as you also mentioned that we have done a lot to introduce a digital communication and courses for students from March. I want to listen from you that how you think youth should utilize this opportunity for this new generation courses or either the entrepreneurship. The young people of Gujarat, what do you think they should do to engage this more?
It's a wonderful question. Being alive, we are evolving every day in our practices, in our belief, in our way of understanding things. We are evolving every day. But we are missing one particular point, that why we are evolving. And evolution in a way is leading to confusion, where we are not able to feed the youth of this country. Let me give you an example. Everybody is talking about a digital platform and availability of e-contents, and somebody is offering it free, lifetime free, who wants to study. You write DNA in Google and just enter, you will have 100 pages to understand. But it is confusing. What to adapt, up to what level, and what is exactly for me to find these particular answers is very difficult. And for that, you need to have mentors. I tell you, a student sitting in some rural area where they don't have the connectivity, how we are going to provide this digital platform to them.
We lost you. Yeah.
More than 350 colleges. So if you say each and every corner of this state, we have some establishments and we have to teach them. We have to make platforms available to them. It's not that easy. It's not only the infrastructure what we are looking at, but the temperament of the students and understanding of parents is also very important. Parents would say that why should I spend my data for when I'm paying fees to college, and simultaneously I'm paying for my data usages. So why should I spend my data for my education? Understand the requirement of the society and to provide appropriate platform to them. But then we have to work for that, and that is how we did in Gujarat University. We have 5 Section 8 companies with us. All these companies are centrally funded and state government aided companies, and they all are working for different cause. Like Professor Rai mentioned that they are working for the villages in the Madhya Pradesh region. We also have a CERT extension activity in Gujarat University where we have adopted 5 villages in Ahmedabad and Gandhinagar districts, and we are empowering them for all their requirements, for all sector requirements. If they want to grow crops, we'll teach them that what they should grow in a network farming. If they want to undergo the insurance policy, we would guide them that how they should go for that. If it's a human right issues, if it's a social issues, everywhere conciliation, arbitration, everything is going on. Besides that, we are empowering the senior citizens for computer and digital literacy, and this is a continuous process. And for that, we are awarded national award by Honorable President at Delhi for our social activities. Okay, but when it comes to the individual approach, I would say the creativity and curiousness of young minds would play a big role. You have a platter available before you where you have every sort of dishes with you, but then what do you like the most, you will eat that part. And I'll tell you, many times I give this example that we are not in a race to become somebody, but we are here as an individual, and we need to grow ourselves and develop ourselves to the excellence. I can give you a few examples. Like if you are a vruksh, you have to be a kalpa vruksh. If you are a cow, then you are supposed to become a kamdhenu. If you are a snake, you need to be a vasuki, right? So like if you are a big rock, you need to be a big sort of establishment. So there are many examples. If you are an elephant, you need to be Airavat sort of a thing. So in a particular capacity, you need to excel and reach the highest level. So like I would second what my friend Himanshu said, that we need to complement each other. Higher institutions and institute of eminence, they can handhold the institutions in a state, or a lower institution, those are lower graded institutions in the country. So that is how we can develop a network, and we can make these things available to everyone. That's all.
Thank you, sir. This is the biggest example to say that this is the era, this is the year when we all have to come together. And may it be something in health, may it be to lift up the economy, or may it be educating the young and making sure the future is totally into their excellence. So it's time that we collaborate, and I am also very grateful that Gujarat Youth Forum is coming across, bringing in all the stakeholders together to achieve excellence. I want to, as we move towards the panel, I want you to add up your closing remarks, and mainly want to know about two things. Is that if you think has to be one line about how the young is going to see the next coming 2 years. What is the one thing this young youth has to do in the next 2 years? What is that? And what you personally look forward, you are watching out for in education space in India, especially like within your organization. What is that one thing which you are watching out? So I would request you all to maybe have. I'll start with Himanshu Rai sir.
Okay. So, here is my sort of wish list in one point, since you said that it has to be one point. And that is, I look for the youth in future to be more compassionate. Compassion is the key. And by compassionate, I simply don't mean that you do something, super that changes the universe, of course. By compassionate, what I mean is that you at an institutional level or at an individual level, so both as an individual or as a collective, you need to figure out what is it that you can do for yourself as well as for people around you. So, for example, when individuals ask me, what can we do? What can an individual do? I keep telling them, look, if you can leave your surroundings cleaner than you found them, and if you can leave people happier than they were when you met them, you have done your job as an individual. So this is what I mean when I talk about individuals doing something in terms of compassion. And when it comes to collective, I would also want to see the collectives doing something which they are capable of doing. And one of the things we must realize is that as a collective, we should be doing things that we are good at, not something that we are not good at just because we want to add to the list or check some boxes saying that, look, we did this, we did that. For example, when Richa and Abhishek were talking, one of the things that I've been continuously thinking about is, while we are talking about the digital world, and Himanshu said it, while we are talking about the digital world, is it really desirable? Are we thinking about this? So, for example, we can give the best of resources, online resources, but what about the screen time that all the students have to go through, which in turn screws up their sleep cycle, screws up their diet patterns, screws up their mental health, so on and so forth. And likewise, somebody, in fact, one of the companies has already said that they are going to allow for certain people work from home for life. My problem is that people are talking about whether it is good or should others actually emulate it. My question is, nobody is talking about is whether is it desirable? Should we have work from home for life? Because what is home? Home is my sanctuary. Home is what I come back to feel safe. And if you are bringing my work to my home, where are those boundaries? I mean, I've seen in this pandemic, people call me up at the middle of the night. They call me on Saturdays and Sundays for work without actually taking care of these boundaries because they say घर पे ही तो हो तो क्या problem है और कर भी क्या रहे होगे. And I think this is something that we all need to think about, that not only should we be talking about what this pandemic has done and the changes that have come, we should also be talking about some changes which perhaps we should actually oppose and make sure that we find a way around them. Back to you, Monica.
Great, sir. I personally am tired of work from home. Like I'm the first early adopter of you what you are saying. Pandya sir, what do you think about?
Hello.
Hello. Yeah.
Yeah.
Pandya sir, one thing which you are looking for, and one thing you think that you should take up in coming next 2 years for bringing in the change.
See, life is very simple. We are making it complicated because we are making everything generalized. The things which is good for you, good for me, it is not good for others. We all are having a different requirements. But when we frame rules and regulations, we want that everybody should fall in line and they should perform and study and work together. And the same curriculum what we are delivering in the university system for the youth of this country. I think this way we will not be able to make Atmanirbhar Bharat by any means. We need to have that dynamics within our system where the medical students can undergo for dissertation in linguistics. If you can allow that level of intra and interdisciplinary approaches, then and then we can make some difference. Otherwise, people have progressed a lot, and we will lifetime call them developed countries, and we'll be always waiting for the right time to strike and to work on. So we need to understand our capabilities. We need to understand our responsibilities, and with the basic requirement, whatever society is looking for. I may be having a multi-million-dollar technology with me, but whether it is visible or acceptable to the rural area or to the poor or not, that is a big question. So I need to evolve as per my requirement, and I think our youth can understand what is the basic requirement of the society or the people of this country, and based on the local requirement and local acceptability, if we can develop something, and that is what we call as innovation. Innovation is not it's not a new thing. It is a very old thing. It's a nature of every life that they innovate, because innovation is mother of necessity, right? And it is not new. Right now we are using this term more and often, that innovation is happening, research is happening. Research is what? You are researching things. It is already there. It's nothing new, right? And in innovation, everybody is innovating every day. Something you are innovating, but you hardly label that particular part as an innovation. But the technology which is acceptable to all and affordable to all, and as per the societal requirement, if we can deliver, I think that would be the future. Thank you.
Thank you, sir. I think, yes, every person, every young has to start looking at the way they want to go rather than following everybody else. I'll move to Richa. Richa, what are the things you are looking at, and what is the thing is your expectation?
Thank you so much, Monica. I was thinking about this question, and so I came up with three more questions that I want to throw at everyone who's listening here today. I guess that this is an opportunity for us to think about those questions. I think for the youth and for the fellow young people who are on this call today, my question to you is: what is the one thing that really helped you get through the previous 6 to 9 months? What are your strengths that you found out in the previous few months? I think that is what's going to get you through whatever's coming, beyond today's call and beyond in the new year. And that's a very crucial question that we should be answering for ourselves almost every single day. The second question is for all the government stakeholders watching us today, everyone from the government. What capacity do you need to build amongst yourself to humanize education again and to really make education suitable for every single child who's entering schools? I think this is a very good opportunity for all of us to really step back and build that capacity before we go into schools and schools reopen soon. The third question is for schools and for teachers and for principals and everyone in that beautiful environment. When schools reopen, are you going to start finishing the syllabus, or are you going to ask children what they need? And I think that is something that I'm looking forward to seeing an answer to when schools reopen.
Thank you, Richa. Now this is like, the infinity loop of questions. So I will leave the audience and everyone in this panel to think upon. Abhishek, what do you think? You're the last one. You have to give some very dashing answers.
Yeah.
Yeah.
Yeah. So I think what Lavya is saying is basically very true. It's important now. I think it's important to rethink like what needs to done and what teacher needs to do, right? And even the government needs to think, what we should teach children, what is the more important. And I think apart from all of this, I think the more in terms of equality, in terms of learning, because how we can actually, going to bridge this digital part for all the children. And how I think the one good thing is basically that we should continue with the home learning concept for every child, because it's a good thing because parents are involved and the responsibility of learning is not just from the schools, but even the responsibility of the parents. So it's good. And the last thing that I would say for the youth is basically that, this is the right time, or I would say this is the right time to solve the problem of the nation. I think we have a lot of problems to solve in the country. And this is the right time to basically solve and came out of their comfort zone. So yeah, I mean, that's from my end. Yeah.
Thank you, everyone. As rightly said, COVID is also, so I want to take it as a positive point. This is also an opportunity to regenerate things in education sector. I work in a lot of rural and tribal areas, and I want when these kids go back, when the door of the schools open, they go at least with a new, fresh approach. We meet with the stakeholders of government, all the Jilla Panchayat, all these schools, colleges, teachers, helpers, teachers, parents, they have to see things with new perspective, and we are already on that path. And I would be happy, very happy, that we had a very nice discussion today. And it's my pleasure to have you all esteemed panelists with me today. And can't thank enough to Madesh, Kumar, and everyone at Gujarat Youth Forum. They have been really trying to curate the best of the content, that we talk about the things we should talk about. So thank you, everyone. At this note, I will also invite Madish, that Madish has some video which is going to share the great work they have been doing about. Again, thank you, everyone, and have a nice day ahead, and good holidays if you're taking ahead. Thank you. Bye.
Thank you so much, everyone.
Thank you.
Bye. Thank you so much.
Thank you so much.
Himanshu,
Pleasure.
yeah,
Thank you.
Richa, Abhishek, and Monica for the wonderful moderation. And the day is becoming interesting, with every panel, with the inaugural, and then with the health panel, and now the education panel really went well. And the young people are engaging over a live video session, and they're also very happy about learning experience what we're having here. And I would also brief that tomorrow also we are having two more interesting panels. One is youth in innovation and tech, so that starts at 3 o'clock, and then we have another panel that is in partnership with the Earth Day Network, that is youth for climate. So I request everybody to join the panel tomorrow that's happening on YouTube Live. And before ending, I'd like to run a short video of young people over a period of time. I would request you all to do the video. I'll run a short video. Thank you.
ત્યારે હું મારા હાથ ધોઉં છું.
ઇન્ફેક્શન કંટ્રોલ એ આપણા હાથમાં જ છે.
So normalizing mental health, the same way that we take care of our physical health,
the quick way of then tackling with that stressful situation is to distract yourself.
Around 8 to 9% of the population currently suffer from a common mental disorder.
Recognizing the challenges we are facing, it's a time for generations to come together to reimagine the type of the world we want to create.
યુવાન તરીકે મેં લોકડાઉનમાં જોયું કે આવનાર આફતમાં સંયમ કઈ રીતે રાખવો અને આવનારી પરિસ્થિતિને કઈ રીતે સામનો કરવો.
જે રીતે આપણે તેને ઘડીશું તે રીતે તે રાષ્ટ્રનું પણ નિર્માણ કરશે.
Thank you very much, Himanshu sir and Richa, for joining, and for the great experience hearing you on the panel. Thank you so much, sir. Have a good day. Yeah. And thank you so much, Pushpa ma'am.
Thank you.
For joining. Yeah. Thank you, sir. Thank you. And to all the young participants, so when you join tomorrow we are going to share a live link, right? So on the live link, you can enroll your name and the certificates you will be receiving in your mailbox. So kindly stay tuned for tomorrow's session. There are two panels. One is youth in innovation and tech, and the other panel is youth for climate. Stay tuned for tomorrow's Gujarat Youth Conclave. Have a good day. Stay safe. Thank you so much, everyone. Have a good day. So that's Team Gujarat Youth Conclave signing off. See you guys tomorrow. Have a good day. Bye.